And having been around longer than some people in the room, those are the shortest minutes I've ever seen. So do I have a motion for approval of those minutes?
So moved.
Seconded?
Second.
Okay. It's been moved and seconded to approve the minutes of May 3rd and May 5th, 2016. Are there any additions or corrections? All those in favor signify by saying aye.
Aye.
Opposed? Okay, minutes are approved. And to keep up with the 192650 members of the body that are present, we had Commissioner Sid Lykin. Did you? No, you were here.
Yes.
And Commissioner Faye Stewart and County Administrator Steve Mulcahy are now in attendance. So, any other committee business? Anything for the good of the order? Okay. Then we'll move to item 3, Health and Human Services. I believe we have Rob Roxrow.
I was waiting for that.
Just never gets old.
Never gets old. You know, the problem is we're getting so old that other people's like, who? Who is that?
Yeah. Alicia Hayes, Director of that department. Welcome. And
Hang on,
welcome
we have to put our name tags so you don't forget who we are.
Okay.
And they were made, so we... All righty. Budget Committee, Chair Hinchman, it's nice to be with you today to talk about Health and Human Services. Actually, today we're going to talk about 2 divisions in Health and Human Services. We're going to talk about Youth Services and Behavioral Health. Important that we're here today because the work done in Youth Services and Behavioral Health, a portion of that is integral part of the public safety system. If you take a look at Mr. Mulcahy's board, which is right up here, we get to see it this time. Last time it was back, we could only see the back of it, which was nice too, but it's nice to see it. And you can see how important youth services and behavioral health are to the public safety system. It's also great to be here because of our strong relationships with the Sheriff's Office and the DA, as well as a number of other community agencies that we do, that we work with in the public safety system. We'll also be talking about other parts of our programs that you might not think relate to public safety, but in essence, they all do. First, I want to do a quick overview. So if you change the slides for me, make sure I'm on the right slide. There we are. Before I do the first overview, Karen's here to remind me I missed this part that says introductions of staff that are around the table. Thank you for being here. So I'm going to actually start right here with Lisa.
I'm Lisa Nichols, Assistant Director.
Lenise Kohlberg, Admin Manager, sorry. Naphtali Brenner, Youth Services. Carla Ayers, Lane County Behavioral Health.
And Karen Gaffney, Assistant Director.
All right, so I just want to do a quick overview of the department. These are our divisions. We have 9 divisions, and with the addition of our newest clinic at Delta Oaks, we are pushing 600 employees in the department. There is a lot in each one of those divisions. There's sections in there that, if you drill down, are 4 or 5 sections in each of those divisions as part of the department. And I wanted to also just give you a little insight in that a number of years ago, actually it was about a year and a half ago, we redesigned the department as a way to really strengthen our collaboratives across the department. When you think of those groups that are working together in the organization, if we build a strong department and build those strong collaboratives, then we build that out into the community as well. So we do our work as a collective, and we are much more effective. I'm going to pass it on to the next piece, which is our plan. And I have to say, Health and Human Services, we do love plans. So we couldn't not put in the piece of the strategic plan that is the county's and is ours. And to do that, I've asked Karen Gaffney to cover that part.
All right, we do love a good plan, and this plan actually should look very familiar to you because this is the county's strategic plan. And we're going to use that as the format then to talk about Health and Human Services. So the first thing I would call out, and I know the type is way too small, so you can't read this, but I'm going to go through a couple highlights, and then certainly in the question and answer period at the end, I'm happy to talk more about any aspect of this. But we did want to give you at least a flavor of how the work in Health and Human Services is supported supporting the strategic work of the county overall. So in the upper left-hand corner, we've listed our strategic anchors, and one of the things up there is the triple aim. And I wanted to underscore that some of you may be familiar with that term that we've kind of taken from Don Berwick at CMS, who popularized this concept of simultaneously trying to improve health, improve the quality of services, quality of care, and reduce costs, and at least contain costs. So that triple aim, if we can do that simultaneously, then we feel like we've met our target. So that's our strategic anchor in how we decide to approach our programming. So within the first county goal area of safe and healthy county, you might not be surprised to know that a lot of our work actually falls into that category as health and human services. In particular, I would call out in that first section of safety, we would highlight youth services and the work we've done with the levy that passed to expand both treatment and secure detention beds. So we have an important role there in public safety and with mental health, and I know we'll talk more about those pieces as our time today goes on. We also, in that first category, the county strategic plan talks about the community health improvement plan. And so a lot of our work in the department is really focused on moving forward the aims of the community health improvement plan. The priorities of that are reducing tobacco, obesity, increasing health equity, access to care, and substance abuse and mental health in the community. So that has been a big focus for us and the work that we do in our department, and I'm sure we'll talk about that today and on Thursday as well. And then the last category in Safe and Healthy County is around networks of integrated effective partnerships, and we do tons of those. I think we have 7 citizen advisory councils that work with our department, so a lot of community engagement in our work, as well as partnerships. I would be remiss to not mention, in particular, our partnership with Trillium Community Health Plan, a public-private partnership that last year, I think $28 million came into the department through that partnership. So it's a key one for us and for the county. However, we're also doing a lot of work in vibrant communities, and the first piece there in terms of sustainable regional economy, we have a strong unit in our Human Services Division that's workforce development. So we work with both people who are trying to become employed in the community as well as employers trying to make that match. So we contribute in that way. The second category on the natural environment, you may or may not know that we have contracts with the forests as well as cities to have crews from youth services go out and build trails and work in the natural environment. And then the third element in that objective is to ensure equity and access. We do a lot of work in our department focused on equity, both internal equity in terms of our own staff. We have a significant number of bilingual staff. You'll hear on Thursday in our community health centers the significant number of people who are non-English speaking who get services through our clinics. We do a lot of work in that outward-facing way. Nathleen can talk a lot about the work we've done over the last several years that we've referred to as disproportionate minority youth contacts. We now talk about it instead as racial and ethnic disparities, but what we can do within youth services to correct that. And then finally, in the third category of infrastructure, I think you probably most often would think of public works in that area, but we also have a role in our department of supporting infrastructure in the county. You may or may not know that our environmental health specialists work with all of the pools and spas to do those inspections in the community and partner with DEQ and others when there are concerns in the community and the environment. And then the second category in infrastructure is internal administrative infrastructure. And Lenise will talk more on Thursday about the work that we do in our subcontracted system. We work with auditors all the time, monitoring our internal services as well as the services we contract for in the community to make sure that we're accountable and good stewards of our dollars in the community. And again, when we get to Q&A, we can talk more about any of those.
Okay. So I have to say there is something in Health and Human Services we like more than a plan. We like a plan that rolls up into a bigger plan. And that's what we've done with our strategic plan. It is, it fits so well with what the county is putting forward in their strategic plan, and we're doing that work as well. I wanted to now have Lenise talk a little bit about our budget and our number breakdown very short.
Okay, so our revenue by source, as you can see on the pie chart, is 52% federal grants or reimbursements from federal sources. Decreasing down, it's 22% is other, which is our admin allocation and fund balance. 3% or 8% general fund at 9.9 million, 3% state, 2% local, 1% the local option levy. Of the general fund portion, on the next slide, you can see that it's allocated out 67% youth services, 21% public health, human services division 10%, behavioral health and strategic development, each pays for a portion of a position there. So the total is 9.9 million.
Okay. So, in my life, I get to not only come to these budget committees with you all, but I get to sit on 2 other budget committees. And so I know what it's like to watch a PowerPoint presentation and have it read to you. So I've decided to do that to you today. Reading you right off the slides. No, actually, we tried to figure out a way to give you a lot of information, because even these 2 divisions have a lot going on in them. And then create a way for you to hear this and then decide what you want to talk about. So our presentation will be actually probably about half or less than the full 45 minutes, leaving the rest for question and answers, and decide where, as a budget committee, you want to take that conversation around behavioral health and youth services. So we've developed, I think, a presentation that is fast, furious, informative, and fun.
That's the feedback we're looking for.
So we're going to start with numbers, and these are actual numbers that are not in your budget book, but you do have a handout. Does somebody have one? They can show you what it looks like. There we go. Kathleen's got the handout. Oh, not the handout. Don't confuse them. That handout. There we go. You have that handout.
It says behavioral health on one side and youth services on the other.
But don't try to follow along, because we've orchestrated a little presentation for you. I know that should scare you all, doesn't it? It's really, it's not. We just want to give you the numbers, and then we can talk about them. Like I said, we have a lot of time for Q&A.
The number of weeks that evidence-based parent-child collaborative groups have met at behavioral health, 50.
The number of youth services participating in minor in possession classes, 165.
The number of new evidence-based clinical services provided in Lane County at behavioral health in 2015, 29,255.
The number of youth services community service hours performed, 7,647.
The number of licensed medical professional and nursing services provided in Lane County Behavioral Health in 2015, 8,048.
The amount received from the levy funds for youth services, $1,378,913.
Increase of integrated services of primary care at behavioral health, 153%.
The number of beds in detention and Phoenix, 32.
The number of people currently receiving evidence-based treatment at Lane County Methadone treatment, 182.
The amount collected in youth services victim restitution, 28,866.
The average number of new people that come through behavioral health access weekly, 35.
And the number of youth served at youth services, 1,011. We put in that extra zero. So those are the numbers. You won't find them in your budget book, but we wanted to prompt conversation around those if there's a path you want to go down that interests you. We also wanted to share some highlights from the 2 divisions, and I'm going to ask Lisa to introduce that.
So we'd like to provide a bit more detail for you on the work at youth services and behavioral health. We've asked each of our managers to prepare a few highlights of the key components of their work. It's important to note that these are just a small segment of the overall work that's happening in both of these divisions. If we took the time to detail to you all the work that's going on, we'd be here all night, and it's sunny and nice out. So we will highlight a couple of key components, and then, as Alicia said, we left plenty of time for questions at the end, so we can focus on what interests you and what will help you in your work as budget committee. So Carla is going to start us off talking about behavioral health.
Good afternoon, Budget Committee. Alicia only gave me 2 minutes, so I wrote down so I can focus on what I need to share with you. I'm overjoyed and proud to share with you this information. Over the last 2 years, Lane County Behavioral Health has undergone significant changes, creating groundbreaking new ways of providing services to our community focused on recovery, resiliency, and wellness. Through several new initiatives, we have improved our service delivery model in the community. One such example is our partnership with Public Safety, which has resulted in a decrease in the number of people with mental health issues in the criminal justice system and built resiliencies for those that are there. The second has been implementing our new transformation project from the Mental Health Center of Denver. By learning from the successes of our peers, we have created a new multidisciplinary team of care that generates recovery in our community. The third has been the addition of Connection Point, which is our peer support hub and has led in system navigation through evidence-based practice. The fourth is our groundbreaking school-based health center, increasing access for mental health services in the schools by 33%. Our fifth and final example is the expansion of our behavioral health medical home. This multidisciplinary team-based approach promotes wellness by facilitating and solidifying the integration of primary care and behavioral health. While all of this is exciting and has improved the way Lane County Behavioral Health operates, what I would like to leave you with today is the answer to the question, why? While there are a number of reasons we seek to provide the absolute best services to our community, the one I feel needs highlighting the most is the fact that the majority of our clients are vulnerable. And we as a community are judged on how we treat our most vulnerable community members. Thank you.
And now Kathleen will talk to us about youth services. Kathleen?
So youth services' purpose is to protect the public by reducing delinquency and improving youth's ability to live productively in our community. Youth services keeps the community safe through our detention and supervision services, and youth are held accountable through sanctions, community service, payment of restitution. And I wanted to highlight a few things for the Budget Committee. Youth Services provides educational and vocational training to youth who are at high risk to reoffend. Our MLK school helps youth accrue the credits they need to earn their high school diploma. We have 2 vocational training programs, one in culinary arts and the other one in horticulture. Many of our youth are assigned community service hours. They can complete this work by volunteering in the community at a local nonprofit, or they can participate on the youth services work crews doing land management. And this week, our work crew will place a footbridge at the McKenzie River Trail. Youth Services, in partnership with DHS Child Welfare through the Crossover Youth Project. This project works with youth who have contact with both the delinquency and the dependency courts to address the unique needs of youth involved in both child welfare and the juvenile justice system. Youth Services works very closely with community partners in our treatment programs, supervision, and diversion services. In addition to our work with youth, we also hold as a priority those who are victims of youthful offenders. Our victim advocates who specialize in victims of youth crime offer comprehensive services to victims. For many of the youth we work with, we're asking them to be better skilled, higher functioning, with more emotional intelligence than they have seen in many adults in their lives. We want our youth to leave the delinquency system stronger than they arrived, with healthier relationships, better decision-making skills, doing better in school, and really connecting with our community in a positive way. I believe the work we are doing at Youth Services has and will continue to help our youth on this path. Thank you.
I want to point out that you do have, this is the handout I showed you, that does have behavioral health and youth services. Under the top part of we call them sections, or they could be teams, or they could be, there's probably other words for them, but those are kind of the highlights of what is part of that division. Then you can see we did by the numbers, so those were, we read part of those numbers, and then the highlights that each division manager wanted to put forward for you to take a look at. So I promised I did leave a lot of time for question and answer, because you can see there's a lot of information. So if you would like us to elaborate on anything in the highlight section or anything in your budget book, I will turn it over to the chair. Unless, Karen or Lisa, do you have anything else? I'll turn it over to the chair for the turn it back to you to run the next part.
Thank you. Questions? Okay.
Thanks. So, in our great wisdom back in 2013, we described the levy as percentages to youth services and percentages to the jail instead of a nickel and 50 cents. We're contemplating a possible reduction in the levy amount, which means it'll have a corresponding reduction in youth services funding. The sheriff has made it clear that he's able to continue keeping the amount of local jail beds, in fact, over meeting that promise with a reduction in the levy funds. What impact, is that a reduction in that 1.3 million plus going to affect youth services? Particularly, I'm concerned about getting away from 24-hour intake. It was one thing we brought back with that nickel. That I think is a critical service. So if you guys could just maybe address that a little bit, because we'll be discussing that as a budget committee later on.
I appreciate the opportunity to take this question. You good at that? I'll take it. You fill in the details.
Yeah.
So when we actually look at the youth service budget and that nickel, that piece, that 1 million number I read off to you, that comes in youth services, we use almost all of that to keep the 8 detention beds and the 8 treatment beds and that part that we use for intake. We haven't run the numbers what it would mean because we want to stay with the nickel, and so part of our conversation has been how can we make that happen. We are not seeing the reserves the sheriff is, and there's a number of reasons for that. How quickly we were able to get up and running is one, because we had layoffs and we had just closed those programs, and yes, our staff didn't find jobs as fast as the sheriff. But we didn't do job fair for them like the sheriff did. So we were able to get them back.
It hadn't been closed down as long.
It had not been shuttered as long. And the other thing is it's a smaller operation, so there's less ability to have the reserves when you aren't up and running. But again, we were up fast with getting those bins open again.
So it may be more of a legal question about whether the percentage is.
So
Well, I was just going to share that we're one of the reasons that Christine Moody is not here is because she's finalizing a memo that we'll present to the Budget Committee shortly. And we will show you what the projected expenses for the youth services portion, the 16 beds, is next year, and what the 5 cents that they currently receive will generate. In addition, I think there's around a $680,000 reserve that exists there, so that's a very minimal reserve when you compare to, for all the reasons that Alicia talked about. It's a smaller operation, and so the revenues collected there really are much closer to the expenses, the actual expenses that they have. So again, we'll talk about this in a little bit, but as we review the board order that was adopted, it talks about 9% and 91%, but I think our assessment is that really comes. The 5 cents is 9% of 55 cents. So it was, if you look back, it probably should have, it's pretty clear that the intent was the equivalent of 5 cents going to youth services and the equivalent of 50 cents going to the sheriff's office for that. So
being the original motion maker that added the 5 cents, that was the intent for him. And later on, it was decided by staff to describe his percentages.
I went back and repeated your words exactly, so about the nickel.
Dale?
No. Thank you.
Then Pat.
Actually, I think Steve kind of covered it, and I wanted to point out that Jay was the person who really initiated the nickel that they were spending, and that were allowed to spend on the services. And I spoke with Christine a little bit yesterday morning about it, and she indicated the word about, meaning approximately a nickel of the 55 cents. So hopefully there's enough of a factor involved there that we can really not have to reduce what's been funneled to youth services. In fact, I think, Jay, that based upon what we've done this year with that nickel, it's something to pay a little bit closer attention to what could we possibly do in the future with another nickel.
Commissioner Sorensen.
I'm interested in hearing a little bit more about the waiting lists, particularly in the drug and alcohol arena. where you're trying to rehabilitate people that have drug problems or alcohol problems, and I've heard that there's waiting lists for getting these services, and who knows about that? And
Could I ask you, are you talking about youth services or adult programs?
adult.
Well, I can start, and Carla can certainly fill in the detail. So at Lane County Behavioral Health and our methadone treatment program, we do have a short wait list and are working to add staff so we can bring those clients in. In the larger community, we contract with many of our local community partners here. And some of the agencies, and I don't have the specific numbers on all of them, but some agencies have wait lists. Many of the agencies have moved to a rapid or same-day access model to help reduce those wait lists, to help get people in more quickly and really serve and meet their needs. One barrier that we all experience is staffing. There's a high turnover rate. Some of these positions, particularly if we're looking at provider or doctor positions, can be hard to fill and take some time to recruit and get the right people in place.
Yeah, and just to add a little more history. So about a year ago, we identified a huge need in the community for the methadone treatment program, and I wrote a program expansion model, and we expanded. So we were serving 150. Now we're up to almost 200. We're now writing another program expansion because we very quickly now have 60 people on the waiting list. So we're working diligently to expand the program again and meet the needs that we have.
And that's methadone?
Yes.
And I think, the focus on methadone in particular, I know we've been hearing a lot about and will continue to hear more about the opiate crisis that's happening in our community and really communities across the country. And so there's an intense need for medication-assisted treatment right now. Hopefully, a lot of our prevention work and other strategies will eventually drive down that demand. But the methadone program in particular is a big need.
So how many adults? I heard 60 children.
60 adults.
60 adults. How many children?
That's something we don't have a A&D program at Lane County Behavioral Health for children. If you're looking at the broader community, I can reach out to some of our community partners and get some numbers for you.
How much money would it cost to have no waiting list, so that when people decide that they should seek this treatment, that it's available?
So again, just quick clarification, are you talking about people being no waiting list on methadone? Because that's what we have.
We don't have the standard alcohol and drug program within Lane County Behavioral Health.
Right.
So we're contracting out with community providers that provide that service.
Do we think there's a waiting list of our contractors?
Yes.
What is the waiting list? I'm all about waiting lists.
So I think we can get you those exact numbers, and it'd be an interesting conversation on Thursday when we have Trillium Behavioral Health here too, because in addition, over time, as Medicaid has expanded, more and more of the dollars that used to come to the county to provide indigent services, really people are no longer medically indigent, and so those funds have gone into the Medicaid system. So we can find out probably that waiting list number for the non-Medicaid system and bring that back Thursday, and also talk to Bruce about what the system is on the Medicaid side.
I'll wrap this up just by saying I would like to know how much money it's going to take and to reduce those waiting lists to zero, and whether or not that falls within the general province of public safety.
Okay.
Thanks.
I'd like to ask a quick question, and that's probably directed to you. If the sheriff's office is able to reduce because of the good luck and the planning and the hard work they've done, but youth services, it looks like it's closer to revenue as actual expense. Is it a requirement of the levy that if the sheriff's office goes down, youth services must go down by that same percent? Or is there some wiggle room?
I think that's going to be a legal counsel question.
Okay.
Because the way we describe it in the board order is percentages, but is that what binds us, or that's a good question.
Okay.
It's a really good question.
Okay. All right.
Well, in the packet that we're preparing, we'll have a memo that walks through the issues, and it will include the ballot language and the board order, so you can have this discussion around that. Legal counsel's what they've analyzed and provided to us to date is that the ballot language is really what we're bound by.
Right.
The board order can be changed. I think the board has been very sensitive to making sure that there's consistency throughout that. But the ballot language does not specify. It essentially says 55 cents that will go towards a minimum of 255 local adult beds and 16 youth beds split between detention and treatment. It doesn't specify an amount that goes there. It's the board order that talks about 91% of it. It'll go towards the sheriff and 9%, approximately, it says approximately 91% to 9%.
Okay, one more quick comment. So Alicia, I guess we need to hear from you tonight or today or sometime of your preference. Are you willing to accept a proportional rate to what the sheriff comes up with? So we basically have a non-issue, or do you want to be held harmless in terms of reduction and make a case for that? And you don't have to do it right now.
Oh, I could make it right now. So all along, we've been talking about needing to hang on to that nickel, because you can't, in a secure treatment program or secure detention, it's not like I can go, oh, we just won't have anybody on shift from midnight to 5. I know they might do that in other places. No, you just can't do that. So it's a package. And so what we would end up doing I don't know that we could run 16 and 16, because that's 8 and 8 is kind of how you put those forward. So when we looked at it, and when Commissioner Bozovich looked at a nickel, we looked at what it would take to do 8 and 8, and just because that's kind of how it is.
Right.
Does that make sense?
Yeah. Okay.
Anyway.
You couldn't do 8 and 4.
You couldn't do 8 and 4.
Go ahead.
Yeah, it just doesn't. Yeah, it doesn't work that way.
I was going to try and get a little bit at the waiting list question and the funding. Just coming from the PSCC Budget Committee meeting, that's why I was a couple minutes late, and I apologize. Emergence is actually not using all the funding that we had actually allocated for alcohol and drug treatment, because they are being reimbursed by the Affordable Care Act. So it's not a matter of funding that's the waiting list issue. It's a matter of staffing more than anything. There's funding available there for folks that are on the Oregon Health Plan for addiction treatment. It's now eligible for reimbursement through Medicaid, which it wasn't before. So it's not about us allocating how much money to get rid of the waiting list so much, except for maybe in the methadone program, although I don't know how much that's reimbursable
It is.
now too.
Yes, it is.
Yeah.
It's reimbursable.
So it's a matter of recruiting and retaining enough staff, and in mental health and behavioral health, it is really tough to recruit and staff up. As difficult as we were. One of the discussions we were having was about whether we wanted to try and fund more parole officers with the additional prosecutions the DA's office is doing, and they're not fully staffed right now anyway, because they've had such difficulty fully staffing, similar to the sheriff. That staffing up in certain areas of the labor market is very difficult. So it's not so much the funding that's causing waiting list, it's the staffing capability.
Okay. Go ahead, Commissioner.
Thank you. Just a couple of questions in terms of follow-up. One is regarding the Poverty and Homelessness Board, which we'll talk about later. However, there is a crossover with the Poverty and Homelessness Board and behavioral health. And that is that this year the Poverty and Homelessness Board is going to be working extensively on wet bed housing. And wet bed housing wraps directly into the services that we're providing. And you don't need to talk too much in depth about it, because it still is in process. It's not happening right now. But I kind of turn kind of softball here. Is the providing wet bed housing going to have any effect on our provision of the services in general?
Sure. And when you see the plan that comes forward from the...
Wet bed housing doesn't require you to be sober.
I was going to define that term. That's where...
Commissioner looks smart. There we go.
Okay, go ahead. So what I was going to say is when you see that plan come forward, you'll see it referred to as Housing First.
Yes.
And so the concept there is that if we get people housed, and in fact the data supports if you get people housed first, then you're in a much better position to address whatever their mental health issues or addiction issues or other issues are going on in their life. So I think we've moved away from wet bed housing to Housing First, and I think the plan also calls for supportive housing, which is a particular type of Housing First, and that is a model actually we're very excited about, and I think will significantly impact the demand for services in behavioral health. And that's a model where we're actually providing specific wraparound intensive services like mental health services on site for people in apartment settings or conveniently located for people in scattered site housing to really improve, once they're housed, improve their uptake of the services that are going to allow them to be successfully maintain that housing. So is that
covers it exactly. So, and it's one of the directions we're going in the future is providing more of the Housing First model, which includes the wraparound services that Karen just described. The second question I have is regarding the fact that we have Shanda Miller sitting here, and right now she's undergoing the risk assessment for behavioral health. And I'm certain that Shanda's going to talk about that at some point, but just a moment, how is that going to affect? Or are you wrapping that into your work plan for this year?
We absolutely find this as a big opportunity for Shanda to help uncover some of those details, some of those gaps that are in our current system, and so we can work on addressing them. So we've met with Shanda several times as she's started her audit of behavioral health services, and we'll continue to meet with her, and I'm looking forward to that report coming out so we can see what areas we need to focus on moving forward.
Thank you. And Mr. Chair, I'd like to comment that this department is doing remarkable things, looking into the future and finding new and innovative ways to provide a greater depth and greater breadth of services. Thank you.
But did we achieve our goals of fast, furious, fun, and informative?
That's what counts.
You guys are still all with us here at the Bud, so that's good. That's a good start. Any other?
While we're in the mood of giving compliments, there were two commissioners, Commissioner Stewart and Commissioner Lykin, that spoke to a community group on Friday, and both did an outstanding job of representing Lane County and answering questions of people that are not associated with Lane County, and reflected very well. Thank you both. Thank you. You're up.
Okay. So this morning, Steve, myself, and Sheriff Trapp were able to go speak to the Springfield Government Affairs meeting. And in attendance were both Representative Phil Barnhart, Chairman of the Revenue Committee, and Representative Lively. And the thing is, what we talked about, there was a lot of conversation, obviously, about the sheriff's levy, this type of thing, but I think what they were impressed about was, first of all, Sheriff Trapp understanding the whole issue of behavior, mental health, and public safety, and how the sheriffs around the state are understanding this as such a significant issue. So one of the things that I would highly suggest, and this is going to be obviously after we go through the budget season, but I think we have an incredible opportunity to put our best foot forward when it comes to mental and behavioral health funding in the legislature. And I really believe that what I'm, even the information you're providing here, in fact, I would say Representative Barnhart was asking most of the questions this morning, which I think is very key because of the position he's in. So this last legislative session, the long session, obviously there was a lot of conversation about mental and behavioral health funding, but I believe this session coming up in 2017 is going to be key. And so I think what will be important, and this goes really what Commissioner Sorensen was talking about earlier, and that is, how much funding do you need? I really believe that this is an opportunity to talk about going big. in really having this out here about this piece, because the engagement that not only from Representative Barnhart but Representative Lively was really key. And I know John for forever, and this is a passionate item for him. And so from my perspective, if we're going from a budget standpoint, I think we have a golden opportunity here to really, and what we're going to have to do is, as the electeds, you're going to have to be the brains for us and really bring forth the information that we need to take it home and see what kind of funding can be put forth by the legislature. I think this is the opportunity. I think it's here. And a lot of it has to go, I give a lot of credit right now to Sheriff Trapp, and I think the other sheriffs in the state that are recognizing, in fact, what was the word he used? He used, it was very cruel. That was the word he used this morning about how cruel it is to have somebody who has a behavioral mental health problem and they're locked up in jail. And so I think this is a really good opportunity for our staff. And I think what you're presenting here today is really, this is excellent. This is very, very good. I'm looking at the budget, but we're coming up here to, I think 11 days, it'll be 18 years ago, is when I first decided, that was my first foray into understanding, okay, this is what can happen with somebody who has mental health issues. And of course what happened at Thurston High School. So I think this is a real opportunity for us to really kick it forward and really kick it up. So I would just make sure that even after this budget time, keep the pencil sharpened.
Okay. Thank you.
Speaking of that, many of you know me as a bean counter, so I have one question on the budget. There's a direct information services job, $295,000 with
I'm sorry, we're all getting our budget books. It was a little noisy down here. What was the question again?
Page 131.
The IS indirect.
The IS indirect. Oh, you heard it. You heard it.
Yep.
So I'll let Lenise.
So it's direct information services charge, and there hasn't been anything in the past.
They split the IS indirect, or IS direct was split this year into 2 line items. They're separating out the infrastructure with the direct programmer time.
So that's why it's
So it's a new line item this year.
So did it come from the indirect?
It did. Yeah, so the year prior, the two together in current year, or proposed budget, would be what it was last year in the line item above.
But they're both higher this year.
Well, we have added, the cost of increase for our department, we add programmer time for projects, the electronic health record, other projects we add, so our indirect cost did go up.
And
Our IS cost went up overall.
You are very good with numbers there.
Go ahead.
At the risk of prolonging the discussion, I think it would be great just for maybe a couple brief comments about the Community Crisis Center that was recently opened. So maybe if you could talk a little bit about that partnership, state funding, 12 beds, what that's intended to do in terms of this whole public safety system and provide a resource other than the jail and emergency rooms. And then also if we could touch on the 3 mental health positions in the jail and what that's intended, because those will be 3 positions in behavioral health. There'll be county employees in behavioral health that will be focused on work in the jail. So that's all right, Mr. Chair, just on the Community Crisis Center.
So let me just do a clarification. We're still deciding if they should be with the jail or with behavioral health. That's Carla's looking at me. Did we make a decision? So
I like the decision.
Are they in the jail's budget?
But we don't want to. We don't want to upset the sheriff like we're taking his position. We know where we want. No, I'll turn it over.
So I can talk a little bit about the services at the Community Crisis Center, and then I've got information on funding. So the Community Crisis Center it runs 24/7, and it is available for individuals that are experiencing a mental health crisis that don't rise to the level of hospitalization. It gives them a safe place to go, an alternative to the emergency department or oftentimes jail, for them to de-escalate, for them to stabilize. And then part of the service at the Crisis Center is doing warm handoffs, connecting them with ongoing mental health services. So hopefully we can reduce those levels of crises that they are having and reduce that cycling. So the Community Crisis Center has been open since May 1st, so just a little bit over a week now. And they have partnered with our law enforcement, are working with Cahoots with our mobile crisis services, and are available for those individuals to take people in that are in need. The funding for the Community Crisis Center is a joint project between Lane County and Trillium with a contract that started on April 15th of this year and runs through April 30th of 2017. The Trillium provided $500,000 in carve-out funding for the first year, and then they will be monitoring the services and determining the rate to bill after we move through this first year. Lane County provided just over $363,000 in funding through the life of the contract. Just over $48,000 was for startup, and just over $315,000 for ongoing services. Those monies were a mix of funds. Some were mental health carryover funds, funding that the county receives from the state, as well as some beer and wine tax fund and some Trillium behavioral health funding.
I have a question. The general fund portion of your department, are there programs that pays for where you can measure success?
Yes, so I'm going to ask, Karen, will you cover public health and then...
Sure.
Okay, two-part question. So if the general fund is paying for services, then I would like to ask the group, are there 4 or more people in the group that would like to know the effectiveness of those general fund programs? So we might comment on the validity of having that general fund money in that program based on its success or failure, or do we want to leave well enough alone and not visit it? And I'd like to see 4 hands if you want to discuss that.
I only have 2 hands.
Okay, 1, 2, 3, 4. Okay, so sometime
Thursday.
So can I ask a clarifying question just to make sure we bring you back what you want? So we have specific general fund programs. So for instance, Nathleen's here today. The biggest chunk of our general fund goes into youth services. So how much detail are you wanting about all of the work that we do with general fund, for instance, in youth services? And then we can do the same for public health and the human services division.
Well, that's a very good question, and I guess the genesis of my question is it would be nice to have a sense, based on the results and the research and the best practices and all that, of the effectiveness of the programs that the general fund is paying for. So I get that there's so many beds, there's fixed costs, there's intake, there's certain things, but if there are any programs, like just Pathways, it's still part of the general fund? No. Okay. So,
but for instance, yes, we can come up with other programs that are at least majority funded by the general fund.
Okay, so there's 4 people that would like to have an opportunity to compare the effectiveness and the value of that money against the budget cuts that we're going to be making. Does that make sense? So state your case for the quality of what the general fund is doing.
As part of that, you might consider whether you would reallocate some of those, some of the money to other portions.
No, I appreciate that, and we will bring you the best we can when there's like a chunk of money, shall we say. We actually did this exercise with our management team where we looked at reductions this year, and so we, like before you had money going to developmental disabilities, there's no money going there this year. We already did some of that, how to reallocate it, so I can run over it.
And you have the service SOS forms that kind of capture where each of the general fund allocations are in the department. So we can certainly go through that and ask each of the managers to give a description of how those funds are spent and whether it's evidence-based, and if we have any local results. Is that
Yeah, great. If
what
you've
you're
already
hoping
done the
for?
work or the genesis, great.
Okay.
Okay. Any other? Go ahead.
I'll just kind of add on to that because I was kind of wondering if today was the day to ask the question or not. Human Services, the $1 million we're sending there, we've been gradually ramping up our contribution to Human Services while the City of Eugene's been ramping down theirs. That's one of the general fund expenditures I'd like to have talked about, and whether or not City of Eugene claims that they've just moved their contribution to a direct funding of some human services, which means we're not, as a Human Services Commission, not getting an opportunity to make a decision on prioritizing that funding as a group versus, so we keep ramping up to make up for what they've cut. And obviously, we're not the agency that's got the money. So Eugene managed to pass, the library levy, They've got park levies, they've got, you name it, street levies. They've got multiple ways of taxing through, utility fees and everything else, that we don't have available to us. Yet we're the ones making up for their reductions in fundings. I'd like to see a good explanation of why we should continue to do so.
I'll just tag on to that. They are going to be putting pressure on the budget committee to change that reallocated funding to actual straight funding, and then any of that would go above and beyond that. So this would be a part of us putting pressure on the City of Eugene budget committee. Thank you, Jay, for putting on that.
I just wanted to ask another broader question. That is, you've heard discussion in from the county administrator, from the sheriff, from the board leadership that the county is thinking of lowering the level of taxes on the 5-year public safety levy. And the premise for that is that we're more likely to get the voters to authorize another round if we lower the amount. We're still providing general fund money to the sheriff's office to fund certain aspects of the jail that the levy isn't funding, but the proposal is to, not tax people either in one of the 5 years of the current levy or of the future levy. I don't think that's really all been decided. What is the effect of this on your department? What's the effect of giving up those dollars? And by the way, how much money is it?
So, to be honest, I never ran the numbers on if it's a 5-cent cut or a 10-cent cut or whatever, what will be our proportional, because what I know is we don't want to give up the nickel. So I don't know if that's okay, come out with that strong statement.
I know that's what you don't want to do, but what I'm asking is, what are the dollars behind that statement?
1.3 on the backside of that sheet.
It's on the backside. I know, I'm flipping it.
Is that per year then?
Yes.
Yeah.
And I'll just say again, just we'll have, I forget what time it is, but it's after the break, after we get through the sheriff and the DA, and we'll talk specifically about the levy rate. We will present to you those specific numbers of the expenses, both for the sheriff. You'll see the expenses for the levy fund and the revenues and the various options and the reserve. And then we'll also share with you youth services, the expenses for the 16 beds and what the 5 cents pays for and the reserve that they have. And I think you'll see when you look at those numbers that youth services is really that 5 cents is paying for of revenue is paying for the expenses for the 16 beds, and there's a fairly minimal reserve in place.
As you said earlier, that's why Christine came in late.
And we'll be sticking around for that conversation. We wouldn't want to miss it.
Okay. Other questions? We are right on time.
So I appreciate your time. I appreciate the time for Q&A. We will have the same amount of time. We'll save a lot of the time on Thursday as well and get back to you with your answers to your questions.
That was the best presentation.
Fast, curious, fun, and informative. Thanks, Commissioner. I appreciate that.
Jars for people to put nickels in around the community.
A nickel for you.
Lynn, there'll be room for you across the table.
Do you want to be here or not?
Okay, Mr. Rickoff, Mr. Dunmeyer, welcome.
Thank you, Chair. We're going to, it looks like we're getting up and going again. My name is Greg Rickoff, Director of Operations. I'm here with Donovan Dumeier. I will be sitting on his right, kicking him under the table. We are just coming from a Budget Committee meeting of the PSCC, the Public Safety Coordinating Council, where we could spend, we spent time with Commissioner Posevich. We could talk for hours in nothing but acronyms. We are going to avoid doing that now.
So with Fast and Furious.
Quite possibly we can. I'm going to turn it over to Donovan Dumeier, the manager of Parole and Probation.
Yes, good afternoon. Thank you. There are some exciting things going on at Parole and Probation. I'm excited to share them with you. Incredible progress that we've made, and we'll go through and kind of talk about some of the things today that we've done, and more important, what we've done with our partners most recently. So briefly, let's see if I got this right. There it is. Parole and Probation. We're going to be going over our mission, revenue, staff, team, caseload organization, networks. Phase 2 of reducing risk, dosage. We're going to talk a little bit about that. Phase 3, where we're at today, and then significant constraints and current and future challenges. There it is. So currently, our mission is to improve the quality of life in Lane County by effectively responding to risk, need, and promoting positive change. We have multiple offices. We're located above the CCC next to the Sheriff's Office and the jail. We have multiple locations at Hacksaw, sponsors, West University, Bonita, Springfield, locations, Junction City, Cottage Grove, Crestwell, Florence. Really, we're just out, we're accessible to our clientele, and we're easy to access and real flexible around things that they have going on in their lives. Our primary revenue really drives from CCA allocation, 72%, community corrections allocation. There we go. 72% of our funding comes from that. 15% of our funding comes from 3194. That's JRGP. It's local reinvestment. We also cover supervision fees. We have miscellaneous dollars and other things that kind of contribute to our 100% in making us whole. Currently, we have 47 FTE. We're budgeted for 52.5. We have 5.5 vacant positions. 5 of those positions are parole and probation officers. 2 of those positions we're in active recruitment for. 2 of them have individuals that are pending background and psychological, and one of those individuals is 1617 coming on board.
Should the budget be approved as recommended by the county administrator?
Yes. Team caseload organizations, we prioritize our resources to the highest risk. With that, we have general high-risk caseloads, sex offender supervision. We specialize in domestic violence supervision, gang. We actually operate as part of the INET, Interagency Narcotics Team. task force. We have a drug court, veterans court, and most recently we've introduced 416. Future teams, future things that we're looking at considering, we're really excited to partner with the Sheriff's Office in the event that this comes to fruition. Looking at a Sherman Center PO and an officer there to assist the jail in transition of some of our most high-risk individuals.
416 are for those individuals who flunk parole probation and are going to jail, transitioning into jail or prison.
Right. We're looking
I
at...
just want to try to avoid the acronyms. So
Yep, and I'll talk about 416 here in a second and what that is. We're really excited to expand a mental health caseload. This is something that we've been really working hard to do. We've actually been working with Carla, Behavioral Health, had a lot of conversation about how we can expand this service to our target population. Most recently, I'm really excited, we just put out an MOU for gender specific to target our female population. We just recently acquired a new risk needs assessment to really talk about some of the risk needs that are specific to our female population, and that includes trauma, victimization, and some of those other things that the population encounters. Networks, partnerships, collaborations. I'm really excited, especially in the prosecution stage of this. We actually have a partnership with the District Attorney's Office around the 416. And really what this is it's an opportunity to really identify and use assessment early in the process to really identify whether or not somebody would be better served in prison or whether or not they would be served in probation. And we can meet their needs and risk in that venue. So we've really used assessment. The District Attorney's Office has just been a great partner in this project. We've just had incredible success moving folks into the community and really putting them on a regimented supervision. One of the nice things about this is using that assessment early in the process to really gauge and guide our limited resources. So it's really been an incredible opportunity. The other thing that we talk about here, cognitive behavioral therapy, moving that into to the jail. Very exciting. We've worked hard over the last year and a half to get cognitive behavioral therapy into the community and being a regular referral source, but now we've expanded that to the Sheriff's Office to really utilize that population that's for rebel and denial and really getting them pointed resources with a captive audience. It's helpful. Progression based on readiness. This was part of the strategic plan I presented, and this is important because this is really one of the internal implementation strategies that we've used to really enhance what we do with our clientele. And so we have, over the last couple of years, really incorporated a significant amount of resources and effort into training and best practices, our risk assessments, really identifying folks that we're really targeting and making sure that we're appropriately utilizing our resources. Responsivity, we're addressing barriers on the front end, really using resources and identifying top risk needs to really be guided in our actions. And then one of the things that we're really doing is really doing the continuous quality improvement. So we're doing a lot of evaluation, a lot of review, a lot of coaching, a lot of teaching, and really guiding those efforts. And I'll go through this pretty quick, but this is the risk principle. This really does state that we prioritize our resources to the highest risk. And we know that intensive services for low-risk individuals can actually increase recidivism. Top criminogenic risk factors, this is things that we've reviewed in the past. Attitudes, orientations, peers and companions are the top 2 criminogenic risk factors. That if we had to put eggs into a basket, that's where we would want to land. 10 steps to risk reduction. This is actually kind of the philosophy that we've taken in supervision. And really, it really starts with rapport, building that professional alliance, and really assessment, planning, teaching. And one of the things that we've really put a lot of effort on recently is teaching and reinforcing skills. So modeling skills, role-playing, really teaching skills, cognitive behavioral skills that can really change behavior and be a tool and a skill set for individuals to make different choices in the future. Dosage, this is relatively new. We define dosage as a cognitive behavioral intervention aimed at addressing an identified top criminogenic risk factor. So talking to somebody about the weather or talking to them about what they're having for dinner, what they did yesterday, none of that classifies as dosage. So when we're talking to clients, we're really addressing a top criminogenic risk factor, and we're really trying to, the hope is to apply the dosage. So as we assess people, we know that it takes 100 hours of cognitive behavioral intervention to address a medium risk, 200 for a high, 300 for a very high. What we do know is anything less has been proven ineffective. One of the things that we've done internally within parole and probation, we've actually structured all of our office visits. So rather than having a 30-minute office visit that's based on check-in, we actually limit that to 4 to 5 minutes. We actually put the bulk of our time in homework review. We're issuing cognitive behavioral interventions as homework. We're using that as assignments that they can do in the office. We're actually spending 15 to 20 minutes actually reviewing a skill with them, building a skill, rehearsing a skill, and really getting them proficient. The last 5 minutes of our time in our office visit is actually geared towards assigning homework for the next office visit. This over here is one of 2 homework racks that we've established in our office. We have one in the back hall and one in the front hall, and it's really broken down by risk need type. So attitudes, orientations, family, marital, all those domains are targeted here. And we use the Change Company, the Carey Guides, BITS. We have all types of different cognitive behavioral exercises that we can use to really make changes in behavior. Phase 3, this is really where we're at today. We have been really engaging in skilled practice. We're engaging in inter-rater reliability to make sure that we're conducting assessments with fidelity. We're using review of case plans. We're giving meaningful feedback. One of the biggest areas that we've really put a lot of time in currently is this provider and engaging our providers and making sure that evidence-based practices are in place. One of the things that we've really done is we have put a lot of eggs into the contract revisions. We have spent an enormous amount of time redoing all of our contracts with our providers. And what we've done is we've actually incorporated evidence-based practices into our contracts. I'm also a corrections program checklist evaluator, meaning I can go around the state and conduct evaluations on programs. So we took a lot of those best practices from evaluation and actually plugged them into our contract requirements. And so we also have validated assessments that they will adhere to as part of their contract, cognitive-based curriculum. One of the things that we've done, especially with our domestic violence programming, our sex offender programming, and most recently our A&D programming, is we're actually getting curriculum that will actually address cognitive behavioral interventions. They're skill-built, skill-based, and what's proven to be effective in programming. We're requiring fidelity, meaning they have to stick to the model that they're choosing. Developing treatment plans. Dosage updates has been a big one. Reporting standards, completion criteria, evaluation standards. One of the biggest things that I think we've changed, we've revamped the expectations of our providers. Currently, we now actually require them to submit monthly progress reports. And in this, you can't really see it, but this is the report that's submitted to us monthly on the clients that we have contracted with our providers. And really, it really talks about, there's a section here that's really aimed at dosage. And how much dosage did they acquire during that month? How much total dosage have they acquired? And again, when we're talking about dosage, it's cognitive behavioral based.
We've got 2 minutes left.
Yes, sir. Significant constraints. As you can see, Lane County, we're still leading a high-risk population. We have 1,121 clients. In comparison to our Clackamas, Marion, and Washington, of these cases, 360 of them are assessed as very high risk, largely attributed to past sentencing practices and no files. Currently, our caseload averages 80.5 for our general high risk, 215 for our moderate risk, 53 for drug court, sex offender supervision is 63, DV unit 65, gang is 47, and our 416 caseload is 30. Currently, what are we bringing to the table as far as dosage? Based on our office contact standards, the most in 36 months that parole and probation can bring to the table, given current workload, is 15 hours of total dosage. For our moderate risk population, it equates to about 4.8 hours. So what that really means is if these are our dosage benchmarks, we're relying on our providers to really fill those gaps. We're not really holding our weight, carrying our weight rather. Current and future challenges, increasing the need for additional staff to meet future caseloads. Current caseloads exceeds our staff's ability to really effectively meet dosage. With 15 hours over the course of 36 months, that's not getting it done. And I think we need to look at reducing those caseloads to really give them the ability to engage in the contact and really apply the dosage that's needed. The other thing that we have to consider in the next year, our DA is prosecuting, and it's been reported that we're expecting maybe up to 1,000 additional cases in the next year. The other piece that we have that's a future challenge is housing. Parole and probation, extremely limited in our housing right now. The current office, we're on a 1-to-1 ratio, so every new PO that comes in, unfortunately, we have to move a PO out. So we've really been relying on our partners, community partners, behavioral health, EPD, other partners to house our officers. And in the process, there's an upside. It's a ton of collaboration opportunity in there. So that's pretty much it, and I think that's about as fast as I've ever presented.
Carmen, you mentioned the homework that there's a emphasis on. How well do people do that?
Yeah, so one of the things that we've really talked about, and the POs are just now really getting behind this, and I think it's a new process for our clients. I think they enjoy it. Some will obviously kind of shy away from it, but we've really developed mechanisms for them. So if they do fail to complete their homework, we have lobby space where they can actually create. We create incentive for them to complete their homework because they'll be in our office for maybe 10, 15 additional minutes to complete their homework before they see their PO. So our POs, I think, are getting better and better about making it more part of the process versus just something they have to do. And that would be my hope, is that this just become part of, and we know that in order to achieve the doses that we need, this has got to be part of the model. The check-ins, the 30-minute check-ins, we just can't conduct practice and business like that. I think P&P, we no longer have the luxury of sitting in the cheap seats and just being a broker of services. And so with what we know, especially with the latest research, 300 hours for a very high risk, that's a lot of time.
Yeah, we're going to let folks ask.
Yes, sir.
You mentioned providers and contact. Can you just tell us who a few of those are?
Sure, yeah. We actually provide drug and alcohol programming, emergence. Sponsors oversees a lot of our transition housing. Sponsors and emergence actually also partake in our motivational enhancement therapy and our cognitive behavioral therapy. Of course, we have a contract with behavioral health right now to provide services that we're working through. And so that's just a few. I mean, we have quite a few.
I have a sort of constellation of questions around the high-risk population, and we're whipping through it. So one is, you mentioned something about we have such a high number of high-risk folks because of sentencing practices. So that partly maybe answers some of this, but you had that compared to other counties, which is in pure numbers, but how does that compare to other counties as a percentage of the overall population that you're serving compared to other counties? Because it's no different to just show it's a high number, but...
If I think I understand your question, so how does our overall, so how maybe their sentencing practices, or
how that plays into them being categorized as high risk?
Yeah, so it's a good question. We all
there's sort of an ABC here.
Yeah, statewide we use the same validated risk needs assessment. So it's not like one county uses other assessments. We use the public safety checklist to kind of gauge our funding, and we actually use the LSCMI, Level of Services Case Management Inventory, to actually gauge the risk and needs. And so when you're looking at it, it really is apples to apples. And we engage in statewide inter-rater reliability to really get to those numbers.
Okay, so when you had the chart showing that we have a higher number of folks there than Clackamas and Sonoma and so on, so it's a higher number, but is it a greater percentage of the overall population you're serving compared to the population their parole and probation?
Yeah, we're fairly... I'll go ahead and jump in there. I think a lot of the counties are getting it to it earlier and are intervening at a level where folks are low or medium or high risk, whereas because we had some time where no files were going on, folks were able to really build their criminal skills and become more sophisticated, more actively involved in criminal activity. So that I think what we're seeing is that big chunk of no files having impact.
So that's
the
what
populations are relatively the same. Ours are just more sophisticated in their criminology.
Okay.
These are like-sized counties.
Right, so that answers the next question of the why are our numbers so much higher? So those counties have been addressing it differently, and folks have been, interventions have happened sooner in those other counties.
Correct.
That's why our numbers are so much higher. And so I kind of know the answer to this question, but does it take more money to serve that level of
Absolutely.
client? And so what, where do we cross in the savings if we, you know what I'm asking?
In comparison, our high-risk population takes quite a bit more. And I think the breakdown, and Lynn might be able to help me with this, is it $30 a day for high risk?
Well, I'm going to just jump in here and
So that's
say
what I'm getting at. Is to put the money in to keep fewer people from even getting to that high risk category.
What the district attorney is doing is spot on. And, getting after folks quickly, intervening, getting folks engaged in the process as quickly as we can, but having a systems answer is really the way to go.
And where you see that is, you take Marion County, for example, they're fairly quick with prosecution, and you can see the earlier you intervene, really the higher this number should be, because you're intervening earlier in that criminal history, and you're not allowing that graduated practice of criminality, so to speak. So if you can intervene like the DA's office is doing well here in the future, I think we're going to see these numbers shift.
So I'm just trying to do quick math, because that would have answered if there were totals on the far side for the total populations for each county, then it would have been that first question I was asking about proportionality. But I'm kind of getting it doing some quick math
Kind of
here.
get it just by they're flipped as far as.
Yeah. Low high is.
Yeah. Great. Thank you.
Okay, Pat?
Just a kind of a simple question. Our performance auditor is going through a risk assessment for behavioral health. The sheriff estimates someplace between 50 and 65% of the population of the jail are suffering from behavioral health disorders. How do you see the assessment that our auditor is going to be providing you? Are you going to be able to use that to help you maybe shift some of those numbers from the left side to the right side?
Yeah, and one of the things about the behavioral health population, typically when especially with our probation folks, we may not know until well into supervision that those folks are even have behavioral health issues. Our post-prison population from prison, we have a pretty good idea based on the assessment, based on the interaction that they've had with providers. But with the probation population, which is about half of our population, it really is prone probation going through and kind of discovering behavioral health issues and making that referral. One of the things we've talked a lot about doing is at intake, we're looking at a full risk needs and responsivity barriers. One of the things that we've been working on, and I actually got a PHQ-9 from our behavioral health. Yeah, see? And we're actually looking at putting that in the assessment process as a screening mechanism on the front end so that we can get in the ballpark and really be able to comb those folks much quicker and get referrals off much earlier in the process so we don't put that ownership entirely on the probation staff.
And very quickly, the ultimate result of this, and I'm looking at Shanda and you both as I say this, is the result of this behavioral health assessment is going to help us all to realize the urgency of putting more resources into behavioral health issues, whether it be in whichever segment of the services that we're delivering, but particularly I think into public safety, parole, and probation.
That's big for us.
Okay. It is almost 2:50, so we will take a break and reconvene right at 3 o'clock.
All righty, thank you.
Did you get your psychopathy?
It is 3 o'clock. We have a quorum, and I would like to introduce District Attorney's Office, Patty Perla, our incumbent up for election. Welcome.
Thank you very much.
Yours.
This is my very first time sitting in the big chair to do the budget presentation, but most of you have heard most of the details of this before. So, Becca made some lovely slides, starting with how our office fits in with the strategic plan for the county. I'm not going to read all of that to you.
Thank you.
But our office does fit directly in line with the strategic plan for the county. Moving on. We are broken up into, here are 4 functions. Criminal prosecution, which makes up the bulk of the work we do and takes up most of the full-time employees that we have allotted in the budget that you give us. Child support enforcement is 2/3 grant funded, so it doesn't cost you very much. And yet, in the last year, our collections were up 10% to $22 million. Services and support to victims and witnesses, again, a large portion of that is grant funded and is constitutionally mandated. And then the death investigations, the medical examiner division, we have 2 full-time employees and then about 5, 6 people who have medical backgrounds who are willing to work on call for next to no money just for the experience of getting to get called out in the middle of the night on the weekend or at night to help cover a 24-hour, 7-day-a-week schedule, because you can't do that with 2 people. I should have mentioned back under criminal prosecution that 6 of our lawyers are either partially or fully grant funded, and 3 of those positions, one of them, the grant already ran, and we received additional funding out of reallocation of money by the PSCC Budget Committee to keep that position going through August of 2016, but it is in your proposed, that position is still in the proposed budget. 2 of those positions are funded by our JRI grant that will run in 2017. They are covered for the next year. We receive a stipend from the Interagency Narcotics Enforcement Team that funds the better part, if not all, of 1 lawyer assigned to investigate or to prosecute drug cases and handle forfeitures. We have 1 full-time position covered by treatment court, and we have a little tiny $25,000 grant that goes to support one of our lawyers on the domestic violence team for the sexual assault on campus, a grant that is received to put a team together to address sexual assaults on the U of O campus or to U of O students. Here are our highs and lows, and you've seen this over time. In 2012, we took a giant hit. We lost about 1/3 of our staff, both lawyers and clerical staff, in 2012 in response to just a terrible, terrible budget for Lane County. And through receiving grants and a little bit of uptick in the county's general fund, we've managed to pick up quite a bit of what we lost in 2012. And so, if you've had a good enough look at that, I'm going to show you what's really dramatic here. Ready? I need a drum roll, please. Because we lost 1/3 of our staff, we were no-filing, about 30% of the viable felony cases that were coming into the office, drug cases and property crime cases. You might recall that we didn't have a very sufficient jail in Lane County, and so we weren't even bothering to file on people until they were ready to go to prison. So we would let them amass these huge criminal histories and victimize lots of our residents until we were in a place where the jail could hold them and we could send them directly to the state corrections. Well, then all of a sudden we got pressure from state corrections to stop doing that. The voters approved the levy here so that we could get some jail beds, and we managed to get some JRI money to help divert people from prison, and that gave us those two lawyers from the Senate Bill 416 money. So this is a snapshot of what we were doing in the no-file range. If you see those 559 drug cases and 317 property felonies, that was between January and July of 2015. And you say, well, what's the significance of January to July of 2015? Well, on August 1, I became DA. Was actually sworn in on July 31st, but this is what happened between August and December. So with the addition of the two lawyers with the 416 money and the grant money that we had from the CDR diversion, that's now not grant money, it's just a gift, and hiring this incredible lawyer from Lincoln County who is devoted to our treatment courts and making the lawyers see the benefit to the community for taking on tremendous caseloads. We now are down to this on no files for the second, well, a little less than the second half of the year. So that many fewer people were getting victimized in our community. And I was at a meeting where Chief Peter Michael Kearns from Eugene Police was speaking, and he noted that in response to our filing more of these cases, that they've actually seen a decline in some of the property crimes within the city of Eugene. So it's been really good for the community. It's been really good for parole and probation, for our future, for community corrections dollars. It's been a burden on the lawyers in our office. We've lost a number of lawyers in the last few months. We currently have a vacancy for a mid-level attorney. We're losing a senior attorney at the end of this month to retirement. We lost one to DOJ. We lost one to Love. He moved to California. So we've had a lot of challenges. We've had a lot of vacancies. So I have to give props to the lawyers and the clerical staff for assuming this much larger caseload, and especially as we've had so much turnover in the last 6 or 7 months, that they're willing to take that on.
Could you show the previous slide? Just rock back and forth.
Wait, I'm going to show you this one. Ta-da!
Even better.
Thanks, Becca. You're welcome. So, there you have it. We have also seen an uptick in the number of cases law enforcement is sending over as we are filing more cases. So workload has increased dramatically for our clerical staff, and we've had a tremendous amount of turnover in that. I have to say, a great economy is good for some things. It's not so good for retaining staff when you're asking them to do tremendous workload in a not beautiful environment, and now people are hiring, so we are having turnover.
You say not beautiful environment, you mean
the building is not beautiful.
Okay.
It is not.
Yeah.
If you've ever seen the cubby holes they call offices up on the 4th floor of the courthouse,
Yeah. But I'm happy to be there, and at least they're going to tell me they're happy to be there. So that is the portion of it, I would love to entertain your questions.
Lori?
Thank you for that. The campus sexual assault person, is that a full FTE that's dedicated just to that work, or is that a
No.
part of someone's?
That is something that was added to a person on our busiest team's caseload. We used to have 5 lawyers full-time on the domestic violence team. We're down to 4, so her caseload was bigger anyway, and then because it was important work, she assumed these additional responsibilities. The money went to paying for her pager. Her cell phone we have a great system called Smart Pager, so nobody has to carry a pager. It just connects directly to your phone. And so she, for the money, is getting to be on call 24 hours a day, 7 days a week, and we pay the pager company, and she gets a stipend for being on call, and managed in no time. It was incredible how she, the 2 of us, sat down with all of the necessary partners in about 3 weeks to get this grant.
The same subject, or should we move on?
No, it's a different subject, a different question.
Okay, let's go to, actually, I have Dan next.
Yeah, so I think in the previous presentation from parole and probation, they talked about prioritizing their money to the highest risk offenders and stuff. But you see a pretty even drop in everything. Is it just the nature of the cases, or like, I guess I'm curious why you wouldn't see one go to 0, like the most important one or something like that. Does that make sense?
Saying that it's not filed for resources could be a number of factors, like the case isn't really something that rises to the level that you would want to invest resources into it. But these actually were the cases that we were no filing for lack of people in the office to carry that caseload. The behavior ones, a lot of those are going to be misdemeanors. The drug cases are self-explanatory. The traffic cases are going to be not DUIs. DUIs, if they are prosecutable, are always filed if there's sufficient evidence. It's not, driving while suspended. We don't file a lot of driving while suspended cases. The felony driving while suspended cases, they frown on us if we send people to prison for that.
A couple questions on the budget. Looks like you have 2 grants from Department of Justice. One of them is $367,500 that wasn't in this year's budget. And you have a proposed budget. It's on page 113.
I don't have that. Which grant is it?
Department of Justice.
That is a mixture of several grants. Part of it is a Violence Against Women Act grant, and I believe the other 2 pieces are the Community Prosecution Grant, which is ending August 31st, but general fund money was added to continue that person's prosecution of low-level felonies. And then the third piece is the 416 project, and those are all flowing ultimately from the Oregon Department of Justice.
Well, the 416 grant we have funded through 2017, so I don't know why. I have the disadvantage of not knowing, looking at the same thing we're looking
Yeah, I
at.
guess my question is, there's none of that in this year's budget, at least on the...
Oh, you mean for fiscal 15-16?
Yeah.
For 15-16, we didn't start billing the grant until spring of 15.
That actually comes from an accounting issue. The money we don't receive directly. It's received by parole and probation or the sheriff's office. So they code the money to come into us. And so when I put the budget together, I wasn't certain where they would code the money, so I had to guess. So it's in there. It's just in a different revenue line.
Okay.
Mr. Sorensen.
Interested in hearing some of your perspective on this discussion the Budget Committee is having about what to do about the amount of taxes that are coming in on the jail and youth services levy. And if you have any insight you'd like to give us.
Well, I had a conversation with the sheriff about if you have the money, why can't you open more jail beds? And the answer was, it takes so long to hire sufficient staff to open additional beds, and then comes the time you need to renew the levy. And so I defer to the sheriff on the management of the jail and support the decision to return some of the money to the taxpayers with the hope that they will want to fund more of law enforcement in the future.
We've been told that that's going to require a reduction in the money that youth services gets.
Well, that is a problem.
Okay, well, we can do our end of it, but your perspective would be welcome.
Well, I would love to participate in those conversations.
On that vein, and then I've got Lori and Pat. I guess my direct question to you is, if we reduce the sheriff's levy, will that affect that chart, particularly the right side of the chart?
If the sheriff's levy will be, as long as he's staying at the same level of beds that he has now, that will not impact our ability to hold people until we can get them into court.
So that's based on the 317, which is the current amount, and so that won't change as long as we stay at 317.
Well, and as long as we keep the same number of lawyers that we have. I mean, we keep bleeding lawyers. At some point, we're going to have to reassess.
Okay. Laura?
I'm just curious if you collect or where we can find data, demographic data on prosecutions, particularly for the drug and traffic offenses.
What kind of demographic data are you looking for?
Race and ethnicity in particular, or just generally.
I can tell you that to run a report that has race and ethnicity requires it's the disposition report is the only place that comes out, and so every case that's disposed, every detail of that case comes out, so it's a many thousand-page report. When we were trying to figure out how to get that information, I can tell you from my conversations with the jail that over 90% of all of our prosecutions are people who are designated as white.
I was just thinking about the interplay with the new profiling, the bills that passed last session around profiling, which is stops,
right?
Which is different than prosecutions, but just thinking about it.
So our software that was promised to us that we were going to be able to run whatever data we want to get out of it, we have to ask the vendor to run stats for us on anything that's not a pre-designated report. They won't give us the ability to create our own reports. So while there are many great things that came from this particular software, that was not an accurate representation.
Commissioner Park?
Thanks. And I think it's important that we drill down and get that information, whatever order we can at some point.
Right. The court does not maintain that at all. And so I've been getting my information from youth services in the jail.
And there are problems with the designation that I think using federal designations, I've heard from the sheriff that it doesn't necessarily match with what we would recognize as a racial or ethnicity divisions.
That's correct. And our entries into our database are based on what is written on the police report, because we don't actually see the people until somebody goes into court with them. And so when the police report comes over, that information's entered, and so white is going to be overrepresented.
My question actually was, and this is a tender one, they're pretty, you have a campus sexual assault position that's being grant funded. or a part of the position is being backfunded.
Right.
A couple of years ago, we had a pretty high-level sexual assault that was not prosecuted on campus. And it was actually prosecuted in the media and was prosecuted by everybody else, but not prosecuted by the DA's attorney. Looking at these numbers right here, in your estimation, realize that there are mitigating factors. With these numbers right here, is there a possibility that those 3 cases might have been prosecuted?
That had nothing to do with resources. These are lower level
Gotcha.
cases. That case, however, would be handled very differently today because when it was reported, the team would be assembled and that woman would have had access immediately to advocacy, to the prosecutor on the case, to law enforcement detectives, would have been advised whether, what the procedures would be and would have been able to decide whether or not she wanted to participate in any level of that investigation and would have been the driver in that. Ultimately, given the facts of that case, it probably wouldn't have been filed anyway, even with the team, but things would have been handled very differently.
So based upon the way you're handling the resources after August 1st, based on this chart right here, you are able to more effectively then at least make a decision as to whether or not to prosecute a case like that. Okay.
Right, and in that circumstance, the U of O has committed to allowing the detective and the Title IX investigator work together so that people are only interviewed once instead of getting multiple interviews. Everybody knows what the evidence is, and it's modeled after the Child Advocacy Center model, but ultimately a lot of these cases still are not going to make it to be able to be prosecuted. It's just a better way of handling it, and if a case is going to go forward to prosecution, it will be in the best possible posture at that time.
Excellent. And the visibility of why it does not go to prosecution is going to be a little clearer, perhaps.
Well, we will be able to explain it with the victim's permission, but ultimately, all of that information that made it into the media is not going to happen that same way again.
That was kind of what I was trying to go down to, is that what happened at that point in time has had a change in the way you handle things in your department.
Yes.
Okay, thank you.
Okay, Commissioner Atkins.
Thank you. First of all, nice chart, and it's really positive, so I really want to say thank you for that. A couple questions. First question is, we had a significant spike in traffic fatalities this last year in Lane County. There's this issue of potential distracted drivers. Is this something that would rise to the level if something came before your office, or as far as prosecution is concerned, especially if it involves life or property?
There would not be a case that wasn't filed for resources that involved life or property. But what I can tell you, the reason we have so many traffic fatalities is because we don't have any troopers or deputies on the road.
No.
People feel completely free to drive at whatever speed they want to under whatever circumstance because there's no consequence for it.
I'm sorry, I didn't hear. Could you repeat that?
It's been an ongoing discussion, and
No one tells why there are no deputies
on that issue. Question number 2 is Springfield Jail. It's municipal, obviously, and it's a misdemeanor jail. I believe it's overhead capacity, and it's 100 beds. So my question is, do you have a relationship with Springfield and potentially where it frees up Lane County Jail in the relationship with Springfield to send potential misdemeanor charges to the Springfield Jail?
We don't use a lot of misdemeanor capacity other than for DV and DUI. The Springfield Jail is not able to take people with any medical problems, any psych problems,
And no females.
and no females. Now, I can tell you that I have contracted with the Springfield Jail to hold child support, enforcement, people who haven't paid their child support, and we get a warrant for them and bring them and promise the governor that they're going to be held until they get to court. And it created a conflict between the then sheriff and my office and the Springfield Jail, because we were told that they did not have authority to contract to take circuit court people. So I am not in a great position to answer that question.
No, and it was just curiosity more than anything. And by the way, that jail sucks. If anybody has ever, and I've heard stories of people get locked up, it stinks, and they do not ever want to go there again.
Exactly.
It's awesome. The stories have been that there have been people who have said, no, you don't understand, you're sending me to Lane County Jail, and they get in fights with the police officers there, and they said, sorry, you just fought me, you're going back in our jail. So they do not want to come to Lane, or they want to come to Lane County Jail, and they want to get the hell out of it.
Oh, yeah. If you go over and watch them, there's like the 1 hour where they come out and they walk in a circle, and that's why Springfield has great revenue from that jail, is people post money to get out.
They don't, no, it sucks.
Commissioner?
Thanks. So I want to get into something that's a really small part of your department, but that's the medical examiner offices. I was familiar with a case this recently in the last 6 months where somebody passed in their home with their spouse present, actually, but could not be moved, and this is in the Florence area, because they couldn't get a medical examiner to approve releasing the body to the funeral home or a representative from the medical examiner for like 6 hours. And so the spouse has to deal with having the body of the dead spouse in their home for like 6 hours. Is there any way to either deputize more people to release in conditions like that, where it's not so much an unattended death, or some way of improving that service, because it's a real stressful time anyway for a family member. But then the funeral home is there local in Florence. They're willing to pick the body up, but there's no one to release the body to the funeral home. Is there some way we can take a little bit and go a long ways towards improving that timing issue? Or is that a change in state law that's got to happen?
Not everybody who has someone pass in their home is going to be under circumstances that everyone knows what happened. And you would want, under some of those other circumstances, to be assured that there wasn't any foul play or anything that happened. And we only have 2 full-time deputy MEs, and so we're relying on these extra help people on the weekends and at night, who often have to make phone calls to either Dr. Davis or to one of the full-time MEs to say, what should I be asking for? What information do I need to get? Do I need to go to the scene myself? And then talk to whatever law enforcement is on scene. And it would be great if we could have somebody actually in Florence and somebody in Oak Ridge on call, but that costs money. And we don't have any, sorry, but if we had a fully staffed people with the same level of expertise and experience as Kat and Jenny, who are our full-time employees, the service level would definitely be improved.
That's too bad that happened.
It is too bad it happened. And
pretty horrible.
Yeah.
And it's a fairly prominent community member.
But Even fairly prominent community members
Yeah.
sometimes have.
But it just builds on the whole that we don't do anything west of the tunnel issue. And they have to sit and wait 6 hours to have a somebody move.
Well, we need somebody over there.
Yeah.
We need somebody who is, medically capable, if it's a nurse or an EMT who's willing to take the on-call. Only over there it would be on-call all the time.
Or maybe something we can work with Saginaw Valley Fire on.
Steve, you're on the queue. We're almost out of time.
Oh, sorry.
Go ahead, if there's a commissioner or a budget committee.
Well, I was just going to state that as a husband of a wife that works for a funeral home, it's really difficult. My wife will go out on call for 4 calls in one evening, and that's just one little funeral home in the entire county. And most of those calls have to go through a process of being released by the medical examiner through either a deputy or a policeman or something. So, it'd be nice to be able to address every single thing that happens, but you got to understand the business a little bit too. It doesn't hurt to try to find ways to improve it, but some circumstances you're just not going to be able to deal with just because things happen.
Well, we still should be able to provide better service in the outlying areas if we just could staff it and fund it.
Can we conclude, or do you want to?
I just want to make a comment about, you had asked Mr. Chair about the impact of the jail rate, levy rate on the DA's office, and I want to say of all of the general fund departments, all the services funded by the general fund, there were only 2 departments that took no reduction, including assessment, taxation, and the DA's office. And so that was the starting point. And what I don't think we talked about here was we added 2 positions. We had a deputy DA position and a paralegal position because of the approach that the district attorney's office has been taking over the past several months. And I don't, just for a minute, Patty, if you could maybe touch on your anticipated impact of those 2 positions on the right side of that chart, if that will assist both in helping to stabilize the workload for the staff as well as impacting the ongoing no files in the future.
Well, as I mentioned, we're actually getting more police reports in response to filing more cases. And so I can't tell you if that's going to change dramatically. I can tell you that if we keep getting more and more reports with, well, not being able to fill all the positions that we have, but even if we were filling them, we're going to be filing on those additional cases that we're receiving, and you're going to see, hopefully, over the long term, a much better impact in the community that will start addressing the behavior crimes, the people causing havoc in the downtown area.
And then, as was alluded to, both the impact on the community in terms of community safety, but also in terms of parole and probation, that downstream we should see, hopefully in the next biennium, an increase of the total pot of money in the Community Corrections Act. State funding remains the same. We should see an increase in, depending on what happens with the other counties, but we should see an increase in state funding for parole and probation in future years because of these additional filings.
Well, even if the other counties have impact from things like the prison diversion grant, the JRI money, and the 3194 money, we're filing so many more cases now that we weren't filing before that are going directly to probation, that's got to have an incredible impact on the next biennium CCA dollars.
Okay. Well, thank you very much. Great job.
That was my pleasure.
So Jay, if you use 36 as no tunnel. Huh? But if you use Highway 36 as no tunnel.
Yeah. They still talk about west of the tunnel.
getting older.
Ferndale, I got there was.
It's a reunion. I didn't get to ask her what non-alcohol DUIs are.
Yeah, that's good enough. I've elected to reduce it further than that.
Okay.
And it's a lot different, somebody, there's a definitive .08,
Are you gonna ask her that?
That's what I was gonna ask Patty.
Did she get something like an email? I'd be curious. No.
I got to listen to a bunch of work stories.
Okay.
What's the trick? Forward and backwards?
It is 3:35 and we are starting with the Lane County Sheriff's Office. Sheriff Tom Turner, no.
That's okay. That's a compliment.
Okay. Sheriff Trapp, you're on.
Thank you, Chair and members of the committee. We hopefully have shortened this down a little bit from the last couple of years, but we'll just jump right in. Overall, our office structure is unchanged. Still has the 3 primary divisions and the Office of Sheriff. In the effort at the beginning of the budget process to look at all potential reduction opportunities within our office, we were able to come up with 3 reductions in FTE, and then we quickly determined that any further reductions beyond this level would end up being service impacts, if not specific service reductions. So those positions that you see there are reductions where the positions aren't unneeded, but for a variety of reasons unique to each of them, we wouldn't be able to fill them either immediately or for some potential longer. And then the road crew position was a funding piece that it didn't look like that funding was going to be available for this budget year. So the first division, we'll just recap real quick, is the admin division, and these are the program functions within that division and the associated revenues that come with those. Of note in there is that CHL is one of those programs that receives generates some revenue. And we're up to over 19,000 CHL holders now in Lane County. It's about a little over 5%.
CHL is?
Concealed handgun license. Sorry.
What was the number again?
Over 19,000 holders of concealed handgun licenses in the county, which is just a little over 5% of the population of the county, and climbing quickly. And this is one area that we struggle tremendously on trying to keep up with the demand. We've tried a number of things, from scheduling options to walk-ins. We used to have tens of people, sometimes it seems like 30 to 50 people stacked in the hallway waiting to get in. So we've found a way to try to eliminate that stack of citizens waiting in the hallway with frustration, and but now there's a waiting list to get a schedule, and so we're still working through that. It boils down to a staffing issue. And then the other kind of a key piece from the admin division is that there's a lot of grant management that goes on there. This kind of gives you an overview of the grants, and probably most importantly on here that is worth noting is the bottom half, third of that, is that a lot of the grants we manage have direct benefit beyond the sheriff's office to our other partners, funding deputy DAs and parole and probation officers, support the drug team locally in the county. So those are programs that we've managed for some time and will continue to as part of the partnership of the services there. And then corrections, same kind of overview here, the listed programs. Many of them also come with some revenue generation, certainly the jail bed contracts with the Marshal's Office, the City of Eugene. I won't read through all these, but if you need me to back up or have a question, just jump in. The question came up, I think it was last Tuesday night, on how are the jail beds funded, which monies buy how many jail beds. So this is a quick breakdown of what we've been able to put together on how those are identified over the last period of the 3 years, starting on the far left column as it stood when before the jail levy, or when the jail levy was passed, and then the bottom half of that is the local beds, the top half is the total jail capacity. And so you see there we have about, today, in the blue column on the right is the budgeted amount going forward. So we're looking at about 75 local jail beds funded by other funds beyond the levy. Clearly the levy picks up the majority of those funds, or of those beds. And then we're at 317, we're at a high of local jail bed capacity that we haven't achieved in the last 13 years.
What's the local federal cap?
So I don't know what year this was, maybe somebody knows. We were sued in federal court for crowding in the jail in the mid-80s.
86, somewhere in that range.
Yeah, and this was a movement that went around the state of Oregon. There was an attorney that made a project out of establishing capacity limits on jails around the state, and Lane was one. And so the outcome of that lawsuit to limit overcrowding in the jail was that the court ordered the county to never hold more than 93% of our available capacity. So once a day, we have to do a count that determines our population at that point, and then the amount over 93% is what ends up being the CBR, the capacity-based release. So that's why we have that forced release process.
Before we leave that slide, Byron, where is like intake and the rest? I mean, when you talk about that's how many jail beds were funded, are you including intake? What's included in a bed?
That's every bed that is used for housing the jail. So essentially today, the jail utilizes every bed in the facility except the second floor dorms, which there's 96 beds available there.
Right, but there's this, I mean, when you're saying, this many beds was funded by general fund, this much by levy, but do those beds include the intake? Do they include the infirmary? Do they include,
yes.
So you're dividing, so that this covered, the general fund's been covering a certain amount of the intake, and the levy's been covering the part of the intake?
I don't know that we've got it broken out by specific housing unit by dollar amount, but when you take the total jail bed capacity divided by the cost of that and those dollars that go into it.
Sheriff, when you say intake, you might be referring to the bookend process?
Yeah.
Okay, so that's not part of the beds.
Okay, that's what I said. But you can't put anyone in a bed without booking them first.
Right.
So that's a separate process.
Okay, but that's not part of this dollar amount. Okay, I just want to...
No, this is actual cells with a bunk bed for somebody to lay in and sleep as part of their house.
Most of us look at the jail from the outside, bookings inside that building.
Right. I misunderstood you. We have a housing unit called intake. So when you're asking if they included that housing unit, yes, the answer is yes.
My jargon wasn't quite up to yours. So.
He caught on to what you're asking. And so talking about the jail, we have 3 years of review at this point of this community investment that we had with the levy. Like I said, we're at 317 local offender jail beds. That's the highest amount in 13 years since 2003 was the last year that we had higher than 317 local jail beds. And we've incrementally added. The first bar is the existing bed capacity at the point the levy was passed. And then within about a month and a half, July 1 of 13, we were able to over double the capacity of the jail with levy funds, and then a couple of additions in this last year. And today we're more than 2.5 times the capacity that we were when the levy passed. And this is a little more of a chart of what this looks like for the history back several years back to 1985. And you can see the overall history there, and then most recently in 2013 where the jail levy passed. And the blue line is the overall bed capacity because we have rented beds that aren't available for local offenders, and the red line is the local offender capacity. The benefits of this are significant. We have a 65% reduction in our CBRs, or capacity-based releases. The year previous to the passage of the levy, we released three people pending trial for homicide charges, and several people in violation of state statute with the Measure 11 offenders, pretrial, and violent felons. And since the passage of the levy, you can see that we're on the right side there is the Measure 11 and violent felony offenders. And this budget year that we're finishing is not on there, but it'll be another 0 in that category. And then the monthly average of our releases has fallen dramatically. That's the 65% overall. And we've had 2 completed audits. So this fiscal year ends here coming up pretty soon. We'll, this fall, have another audit come out. The audit language in both of those audits is exactly the same except for the date. And I fully anticipate this year we'll have the same, and the next 2 years we'll have the same. And this is confirmation that we are complying with all the provisions, requirements that came with the passage of that levy and the language on how the funds are used. A little bit on some of the partnerships in the Corrections Division. A long list of programs that has been part of the jail for some time. A couple of them that are unique is that we are embarking on a new partnership effort with behavioral health. The plan is to fund in this budget 3 added positions to mental health section of the jail. They'll be above and beyond the mental health staffing that comes with the medical contract. The plan is to contract these through behavioral health. They would be essentially a mental health specialist, a qualified mental health peer, a qualified mental health associate. And the contract with Blaine County Behavioral Health. They will assist in bridging the gap between the Sheriff's Office and behavioral health and create some wraparound service for the offenders that are being released into our community. We'll look at symptom management, case management, discharge planning, group skills management, and coordination of care. And the new mental health staff would coordinate with the offender's family regarding status updates for their loved one, essentially be a liaison. We've had some experiences recently in the jail with some special needs inmates where we struggled to find a way to effectively communicate with the family to reassure them that their loved one's needs were being met while in the jail, their safety and their health was actually being taken care of appropriately. That's a big deal for, in this case, it was a mother that was beyond stress. She wrote a lot of people, including me. And this kind of kicked off the idea of, we probably should try to find a way to and not just with that person specifically had autism related issues, but just broadly look at the special needs population that we have in our jail. And so we'll embark on this effort this year and see if we can provide the ability to coordinate the care of these individuals a little more effectively in our jail, communicate more effectively with their families, and probably most importantly, when we release them from the jail, that these staff can then coordinate their handoff of care to an outside care entity so that they're not just booted from the jail cold and then with no maintenance or support and to be able to quickly turn right back around and land back in the jail. We also plan to add a parole probation officer funded for specifically to work in the jail at the Sherman Center, the Defendant Offender Management Center. And this person would assist the jail staff by identifying inmates under local supervision, under parole and probation supervision. They'll be able to participate in cognitive behavioral therapy in the jail, provide assessment direction for sanctioned offenders for discharge purposes, provide some life skills classes for offenders under their supervision, and assist the Defender and Management Center staff with alternative programs placement of sanctioned offenders on their supervision. And we've begun cognitive behavioral therapy classes in the jail, and this was created through a partnership with Sponsors Incorporated and Parole and Probation. So this is just a little bit more of an effort to provide those services in the jail while those people, as you said, instead of having them just sitting there idly, we can provide that treatment and get them engaged while they're spending their time there. Police Division, the same as the others, has programs that also are revenue generation. programs, so those are listed here. A lot of this in the police division is focused in the contract law enforcement section. Patrol section this year is, again, you'll see up there, receiving federal timber dollars at the harvest rate. And in patrol, we've now have established clearly with the improvements in the jail, from the jail levy, the jail is actually at a capacity and at a position where it's pretty effective right now for the demands of the public safety system. The prosecution rate of the district attorney's office, although I think we'll see maybe some new pressures if her indications going forward stay consistent. But I think the capacity that we have today, we're releasing people capacity-based releases yet, but those are much less dangerous offenders compared to where we were just a short time ago. So clearly today, patrol is our weakest link, like the jail was 3 years ago. And so we're excited that just this last March, we were able to restore 24-hour funding. This committee provided funding for to return to 24-hour patrol this time 2014, so almost 2 years ago. It took us 20 months to fill that. Takes roughly 12 months for a new deputy sheriff, once he's hired, to actually drive their own police car and fill a schedule and on a roster to meet that demand for the 24-hour schedule. And during this window, it's been about 5 years since I think there was a window of time in 2012 where we tried to put 24-hour back in service. We couldn't sustain it. And so it's really been about 5 years since we've had consistent 24-hour coverage in the county. And at one point in time, we were down to 16 hours, which means there was 8 hours of the clock where there was nobody on duty in Lane County. This, no one else to fill the gap means state police doesn't have staff either. At one point in, I think it was December, right around the midwinter period anyway, the state police was down to 8 troopers for patrol in Lane County. So their numbers are up a little bit again. I think they're still a little shorter than we are as far as actual numbers of troopers. And they don't provide 24-hour staff. And so when we're not out there, state police isn't the fallback like they used to be. And what we have learned is that since 2008, or 2007, beginning of 2008, the Sheriff's Office has laid off 98 employees. We've eliminated over 200 jobs, or right at 200 jobs. Huge reduction in services. We could do that really quick. We can get a layoff of several employees within 30 days, make budget, and move on. We're clearly experiencing is the really slow and expensive rebuilding of services once they've been gutted. And that involves everything from recruiting and hiring and training and an ongoing attrition. We still have staff that are retiring and moving on. And so we're down about 21 deputy sheriff positions today. We've hired many over the last several years. And it's just a slow, painful process. So what patrol staffing actually looks like, this is what we have in the patrol group today. We have the 4,600 square mile county. That's from the beach to Willamette Pass Ski Resort to the lava beds up to McKenzie. We serve 108,000 residents roughly in Lane County. And when they call 911 and need law enforcement response, it's the sheriff's office. That's a big demand. We're still only fielding about 3 to 4 deputies a shift. Our minimum staffing is 3. We pay overtime to keep 3 on, plus a sergeant. We can run around 4 commonly, but not much beyond that. So that's a pretty wide spread for those. Kind of equate it to running a small town police department size to a fairly large city demand on the resources. And this is just kind of a reminder, and we've heard this before. And we know national average comparisons are ridiculous for us. That's a beyond a pie in the sky. Even the Oregon average of all law enforcement is unattainable for us. Sheriff Turner mentioned he strove to be mediocre. We strive to achieve mediocrity, but we struggle to get there even at the Sheriff's Office Oregon average, which the nature of Sheriff's Office operations, we run a much leaner staffing ratio than other police agencies do. And so we're substantially behind what the Oregon sheriffs on average provide for their police services. And, we're just right at the boots, and this has been consistent for several years now. I think we're actually down to 0.16 right now. So this is what our patrol services are providing. The deficit we have there is we're still struggling to address most burglaries that aren't residential. So essentially a second-degree burglary, a non-residential or a commercial burglary. Motor vehicle crashes unless they're pretty serious or somebody dies. And then in those cases, we still have a very robust partnership with the state police, where the state police responds and takes most of those major crashes, certainly those that will result in a likelihood of a prosecution. And we still have the CSR program, the Citizen Self-Reporting, on these crimes that we're unable to respond deputies to. In our last year's stats there, you can see that's about 24% of calls for service that are not responded to, or that are not dispatched. The deputy doesn't get dispatched to, so it's still a pretty good chunk of what we're not responding to. An improvement, though, on the CSR return rate. We track how many of these report forms we send out for the residents to fill out and mail back, and we track how many we get back. Last several years, we've been returning about a 30 to 34% rate. So now we're up to 50%, and all that means now is that instead of not having about 60 to 70% of our stats, we're only missing about 50% of our stats. So the statistical data on property crime specifically for Lane County is very difficult to navigate, just because we're not actively collecting it. And I understand that we're funded at 24-hour patrol, so I'm not making a plea here that you need to look at adjusting the funding or adjusting the proposed budget. I'm excited that we're continuing forward with a budget that allows us to maintain services as we have them. My point here is that I think occasionally we get a reminder of what this lack of service delivery provides, or what the impacts are to our community. And I don't want to let us lose sight of what we need to continue to work on, certainly for the Sheriff's Office. So this was a call for service we had last December. Just a couple of headlines from the news. A recap of this. This was a shooting where it involved two residences, two people firing firearms. And the call came into us at 5:16 in the morning. Of course, this was in December. We didn't get 24-hour patrol back online until March. So no deputy sheriff on duty, including no state police on duty. Effectively, there's no on-duty law enforcement in Lane County, outside of incorporated cities that have their own service. So the only way we get a response, we call deputies from home. So deputies were called at home. They were en route to the call. 10 minutes. It took them 10 minutes to get up, get dressed, get their boots on, and get in their car. Fire department with ambulance and crew were waiting to provide medical aid shortly after the call came in at 5:39. First two deputies didn't get on scene until 5:53 in the morning, 37 minutes after we got the call. The medics then came in at 6:05. This was 49 minutes after we got the call. And this isn't our policy. Medics can go in if they want to. This is their policy. They know the details of this call, too. They knew there were two shooters involved in this. They knew it involved multiple properties. But they're sitting down the road for 26 minutes, just waiting for deputies to get there. And then deputies made sure the scene was safe enough to let the fire staff come in and provide their medical care. The medics then loaded this person in an ambulance and left the scene 55 minutes. I just throw that out there just to make sure we're aware of the impacts that we're providing out there in the community, the importance of this service we're providing to the community, and that my plea to you as we continue to work on this and not forget this as we move through this and other budgets, and recognizing that this isn't a negative perspective on where we're at on today's budget. Just simply, let's remember the 10-year public safety plan and remember to not give up in the future what we've gained today. And that's the first strategy of the 10-year public safety plan is let's keep what we've got, find ways to keep what we've got. But we've struggled for 5 years to get back to this point of the 24-hour staffing, and I think it's an understatement to say it's a critical service to the community. And with that, I'm open for questions.
Okay.
Thank you. Sheriff Turner.
He started it.
Sheriff Trapp, last night you spent time at River Road responding to some of the urgency regarding providing sheriff's services in the metropolitan environment. And a couple of weeks ago, you and the DA were at the River Road Parks District talking to the neighbors there. You talked about 55-minute response time in the rural areas. And in the metropolitan area, we have more metropolitan-style crimes, more metropolitan-style emergencies. And the people last night were talking a little bit about how confusing it can be to have whether or not it's a sheriff or the police department, the Eugene Police Department that responds. Can you talk just a little bit about that coordination and any level of urgency that you see there?
Yeah, that's actually, I think that there was some concern that might slow down the police response or confuse the police response in sharing those jurisdictions like we do. River Road, Santa Clara is a unique area of the county it's very quilted patchwork of jurisdictions. One address will be county unincorporated, and right next to it is a city incorporated. And so the sheriff's office has one jurisdiction, and the next door neighbor has a city police jurisdiction. So the reality is we have an automated system in the 911 center that as soon as the address is identified of where the emergency is, the computer automatically or very rapidly identifies the jurisdiction, and the call for service is then routed nearly instantaneously to that jurisdiction, whether it's Eugene, Springfield, or any other city police agency, or the sheriff's office unincorporated. And the reality for a lot of those residents that share a blended jurisdiction neighborhood is that you often will get services from the other jurisdiction if the neighboring residence is the other jurisdiction, but the crime is related and connected. The agency that's there will participate in managing those calls and coordinate the reports to the other agency as needed. So I think in most cases you actually get an enhanced level of service because you effectively have two jurisdictions that are coordinating their efforts together.
And the response at River Road and Emerald Park, people said they've never seen more police cars in one spot at the same time.
Yeah. Well, and that's a little unique. That response was heavier than I think any other day that night, because that was the night that the sheriff's office was holding our awards and promotion recognition ceremony down here in Harris Hall. And just before that call came in, we were just begun the program, and we had several state troopers, several deputy sheriffs, and several Eugene police officers present to be recognized that night. And so they were all right here at Harris Hall, and the whole Harris Hall audience emptied and responded to that call. So the call response was magnificent, but it was also benefited from collecting all those agencies in one spot when that call came out.
Okay, thank you.
Herb?
Referring to that Veneta incident, I actually drove up on that after the deputy responded but before the medical staff was released. It's a very, very scary scenario. It was dark. That's a 45-mile-an-hour road. I could have, if I'd have been through it 10 minutes before that, it would have been after active shooting, before deputy response. The only thing I noticed, I was driving past Houston, I saw the medical staged. I thought that was kind of weird, and then there was a deputy car with flashers on it. Before I got to the scene, I turned around and went the other way, and came upon a school bus that was coming that way. You actually have a spot where you could have an active shooter with delayed response and students standing at bus stops. Anyway, it is a scary scene out there. A question regarding your contract services. Have you seen any changes in the trends as far as the services you're providing to Veneta going forward or Cresswell?
Not substantially. I think somewhere. I think we're seeing this coming year, we're seeing a 50-50 split between the supervisor instead of a third share between three contracts.
Cresswell has increased by one last year. They're planning.
They're talking about it.
Yeah, they continue. The conversations continue off and on throughout, the terms of the contracts, and they're struggling as well as every other government to provide what they feel is a comfortable and adequate level of law enforcement. And so we will continue to work with them as they have revenue to provide to the contract to add staff. We'll coordinate with them to add it.
Has there been any other interest about a public safety district in any place in the county?
No, I haven't heard any talk outside. Well, I think the Cresswell supervisor was speaking with some of the Cresswell city staff about what the Veneta Fern Ridge district might look like in the Cresswell area, but I haven't heard that they've moved any formal planning of that. And the Fern Ridge district isn't necessarily a done, finished deal. I think they're still hoping to continue that discussion with the community and see where it develops yet.
Thank you.
If you were fully staffed, you miraculously suddenly had all those vacancies filled next week, how would it change the graph with the 3 per 1,000? And now we just have the pair of
It
per
wouldn't
1,000.
change. It wouldn't change at all because that was our policing staff. Our police division is 62 sworn staff members, 60-ish, and those vacancies are in the jail. Those are the positions created by the additional jail capacity funding under the levy.
All of them. So the actual
So the
service.
police division is full. We don't have vacancies in the police division, and when we do, we fill them from the jail generally. And so the police division over these since it's been funded at 24-hour funding, we immediately filled those positions. We double filled them for a period of time, anticipating the training and anticipating future attrition of staff as we tried to get ahead of the training. And it still took us 20 months to get those staff trained and filling the roster. So the police division doesn't change. And even if we have vacancies, we're counting the budgeted positions in that number. So
that's not related to the service delivery and the response time.
Right. That's a budgeted position comparison to other jurisdictions of budgeted positions.
Anybody else? I have a question. I believe the chart showed 236 capacity-based releases per month now. Is that correct?
136 average, this one?
136, okay. So my question is, we're going to have a discussion about levy, and we're at 317. Can you give me a general idea of those 136, kind of what happens? How many show up for court and go through the process? How many do not reoffend? How many do reoffend? What's the impact of those 136 releases?
I'm looking around to see who wants to guess at that. That might take us a little bit of research to come up with that. I would assume, based on the looks I got, that unless somebody has an answer.
A general idea would be, do 135 reoffend? Do 135 go through the system?
If I can answer, I can coordinate with pretrial services to get those specific numbers for you. No, it's not 100%, but it's still probably midway, 50%. And the problem is there's a cost associated with every one of those. Failure to affairs, issuing the warrant, making the arrest, doing the booking again.
Right, yeah, the failure, yeah. I get that. So there's...
I will get those.
Okay, there's going to be a discussion. I know that's coming. Part of that discussion may be, well, if we open up within the budget that you could get and you open up the dorms, what impact? Obviously, that 136 would go to zero.
No, I'm not sure that it would.
Well,
yeah, I don't know that we have the capacity in the county jail to ever get ahead of CEOs.
Okay, but if that population, that 136, is something we need to be aware of, we should be aware of that in that conversation.
Right, and I agree. There's nothing I would like more than to actually be able to open the entire capacity. The fact that there's nearly 100 beds still sitting vacant, and we have funding to apply towards that. my first instinct is, well, let's open them and use the entire capacity of the jail while there's funding. The problem is I've got 21 vacant positions for deputy sheriff. We've been trying to hire, what the levy has created, I think it's 41 total positions now. We had 35 initially, and we've added 6. And so I think we've hired 80 positions over the last 3 years to try to fill 41 positions, and we're still down 21. It's not for lack of applicants. We get 100 applicants at a time every time we post. The qualified applicant pool is minimal. Our standards are high and rigorous. And we hire maybe 5% of the applicant that comes across, and we don't keep all of them, and we have people retiring. We have a fairly aged workforce in the sheriff's office. Until we started hiring this group of newer employees, we were a very old workforce for a law enforcement agency. And so we're at the point where a lot of our employees are retiring. We have a lot of eligible retirees that aren't retiring, and we have several that are at that point that are making that decision to retire. So I don't think in the immediate future that we will have the capacity with staffing to open additional jail beds, and at least not with any significant numbers. And we just really need to, at this point, take some pressure off the staff and not continue to force the overtime. The more vacancies we have, the more overtime there is to cover the schedule in the jail. So it's a balancing act. And when we start on that first slide where we doubled the jail capacity on July of 2013, our staff worked tremendous amounts of overtime. And at first, they were fully engaged as participants. Make this community better, improve the safety, let's get the jail open. They became weary pretty quick, and it took us a year or longer to take some of that severe pressure off of them without reducing the jail population. So we have vowed as their managers to not do that to them again intentionally. And so we have to be very careful with that. And based on that, I don't see us opening significant more jail capacity in the duration of the levy. I think we're at a point we need to catch up with staffing.
Okay. We would need 12 more deputies to open doors.
Yeah, right.
So I kind of have two different questions. So I guess I'll go at while we're talking about CBRs, I'll get to that question, and then I have one about crime stats if I get a chance for a second one. I get these comments that, the folks that were capacity-based releasing, they're all just shoplifters or people that we really shouldn't be picking up, or somebody that's just on a drug possession, minor drug possession, misdemeanor or something. What is, when you see us at the 136, where is that cutoff level? What are we releasing?
What type of crime?
What type of crimes are we releasing?
Do you guys have that?
I can tell you that really fluctuates because as folks come in here, come into the jail, they're lodged. We run through our risk assessment program. So any given day, what we may be releasing today, say it's ballpark figure of 65 CBR points. The next day may be 75. The day after that, maybe 35. So it's a swinging pendulum. It's really hard to attach to that. What I can say is that, again, the violent felonies are not being released. It's more of the property crimes and the drug crimes. Everybody has the opportunity for bail. The CBR kicks in when those people aren't being released. And we do a pretty good job of attrition on a daily basis between those folks that go to court, charges aren't filed, or it's ended their sentence, or something's come to the pretrial services has given them a conditional release. So we do a pretty good job of managing those numbers. But even if we added the 96 beds, well, it would take a while to fill up those 96 beds. At some point, when you become full again, you are going to have CBRs again. The difference is that you're going to have so many folks in that jail that the people getting released are going to be such small offenders. And these are the smaller number of offenders usually have a better chance of showing backup, including the adjudication process, and then going on.
I don't have current data that says exactly what crimes have been released, although I know that in recent months we've seen months where the CBRs have been almost exclusively municipal court charges. And so most person crime felonies are being held until at least their first appearance in court, and usually a court release through the courts, through the judge, or through pretrial. Not necessarily the case every time, but we're at a point now, so I say when the offenders that are released today are much less dangerous offender, and you can never say that they're no longer a danger, but and certainly they have the risk of repeating, and we've seen that in our own history here with our CBR processes. So, but that risk is mitigated dramatically, and they are much lower level offenses than we have seen historically as far as what we're kicking out.
Commissioner Sorensen?
I'm curious about the 96, are there 2 dorm units or just one?
It's a dormitory area that has 4 dorms that collectively have 96 capacity.
Has there been any discussion of using those beds for programs like sponsors or other programs where people are on parole or probation, post-prison, and they don't have enough money to live in apartments, but they do have some connection to the probation system?
To be in there on their own accord.
Could be in there, and I don't know if I've used the term, no supervision,
right,
but minimal supervision.
But not be sanctioned to be there?
Yeah, not be sanctioned. They're not under a federal court or a city court or a state court. They're there because we have 96 beds that aren't being used and aren't likely to be used, and yet we know that
low rent housing.
Yeah. We have 96 beds.
No, the answer is no. I haven't had those conversations with anyone. My initial thought is that I'm not sure I can legally do that, because it's a secure facility, and generally anybody that is inside the secure facility of the jail is there with a lawful custody under my charge. Mm-hmm. And so I don't know how I would integrate a tenant population to be inside the secure perimeter of the facility. They would have to mingle with inmates that are there as inmates, as opposed to somebody that's as a tenant. I'm not sure how effective that would be in their
Might have to blast a door so they can come in and out.
It's on the second floor, so that would have to jump.
Might have to build a rope ladder.
Any other questions? Yes, sir.
Thank you. Sheriff Trapp, I cited a number that I'd heard you say regarding the number of residents in the jail who are suffering from behavioral health issues.
60%.
60%, and I said between 50 and 60%. I had a question for you. We're providing on this budget, should we pass it, 3 behavioral health specialists to work inside the jail, 1 parole and probation officer to work specifically with the folks who are suffering from and transitioning out of the jail with behavioral health issues. Clearly, the jail is not the best place for some of these folks. Do you have an estimate as to what percentage of those? I mean, is there some point in that 60 or so percent that they're really just foolish to send them to the jail? I mean, I'm asking you to.
Yeah. I don't know. I can tell you this, anecdotally only. I don't have a percent number. The reality is nobody goes to the jail that hasn't committed a crime, but there isn't probable cause to arrest that person for criminal behavior. The conundrum is this, is that we have officers, deputies, and troopers that respond to a crisis in the community that involves a person with a mental health crisis. And because there is lack of capacity for emergency crisis shelters for the mentally ill in the community, often law enforcement doesn't have an easy avenue to deliver them to a service that can provide for them to be secure and to be stabilized and begin a treatment regimen. So what that often ends up being is, well, they were behaving in a manner that's in violation of state law, so they can apply a criminal charge and they put them in the jail. The jail doesn't treat per se. The jail stabilizes, and the jail can certainly give them a timeout from their crisis and get them out of the home, off the street, wherever their crisis was occurring, and then reevaluate where they are when they get released through mental health supervision and otherwise. So that's what the hope is with these additional mental health resources in the jail, is they will coordinate when these people come into the jail coordinate what they need for services and get them engaged in services and make sure that they are handed off to a service as they leave the jail. Really the answer I'm trying to answer with this additional staffing in the jail, I'm trying to answer how can we more humanely and effectively manage the population of the mentally ill that come into the jail. I don't have an answer to how we keep them from coming into the jail to start with, and really that is more capacity for mental health services in the community. That first of all, ideally we wouldn't have a population that goes into crisis that causes a law enforcement response. The mentally ill would have care and treatment and managed care and treatment consistently that could keep them from a crisis event, and then all of the care and needs that that person has would be handled without law enforcement. When law enforcement is called, it's because everybody else has lost control and nobody else can control the scene with that person. So law enforcement then has a burden that we can never meet, which is the expectation that somebody who has practiced medicine in psychology and behavioral health, maybe has bachelor's and master's and doctorate degrees in that, somehow the law enforcement is supposed to come in and manage that scene better than they did when they lost control of it. And often those things turn tragic. And so we have to find a way to prevent those events from happening outside of a jail, which will then prevent those people from becoming part of the jail population. This is simply a way to better manage and care for these people while they're in our custody and when we release them back to the community outside of our custody. It's a much bigger conversation and very frustrating. And so I don't have those simple answers, but we have seen in our own immediate community the very, very tragic results of behavioral health staff not effectively managing, not being able to effectively manage those when they get out of control and see the tragedies that unfold here. Nobody's fault, nobody's to blame, but we certainly need to strengthen that system, provide that care. That's what will keep them from the jail.
Thanks for that response. So it's clear to say that if we had other facilities available other than jail, then they would ease the burden on the jail for one thing, but it also provided a more direct response to the people who need different level of services. And so the more we look at funding or finding ways to provide the other facilities, the easier it's going to be to manage a jail with the people who really are violent offenders who need to be separated from the community. And part of that is, as we talked about earlier, perhaps housing first issues, where people who are homeless perhaps and suffering from behavioral health or substance abuse issues are placed in housing. The final question I have for you on that is, of those people, that 60% or so that come into the jail with behavioral health issues, do you know about how many of those have no address other than the jail? That is to say, they are living on the streets or some other place that is not an address?
We really haven't taken the time to do a lot of demographic study on that population. Certainly it's a unique demand on staff, and in a perfect world, law enforcement would not be any part of the life of a mentally ill person, and they would be cared for and treated in a way that kept them from having to engage with law enforcement. And as soon as you engage with law enforcement, you run the risk of being entered into the criminal justice system. It's as simple as that. So we've got to find ways to break that cycle of default care of mentally ill through the jail system.
Thank you, Sheriff. And clearly we're not going to solve that problem here today, but the more we think about it, the greater the possibility is down the road we begin to address more resources as a budget committee, as a county, as a community, into providing behavioral health services that keep people out of the jail. People who don't really need to be in the jail shouldn't be in the jail. And the Sheriff said in a perfect world, law enforcement would not be any part of the life of a mentally ill person. Let's shoot for that day.
Christian?
So I actually am going to just make a quick statement rather than get a long discussion. Just that with our current level of both patrol staffing and the way we report crime in Wayne County, our crime statistics are meaningless relative to comparing ourselves with other communities in the nation. as to whether we're a high or low crime community, which as a result makes it very difficult for me to describe to a constituent the problem we have with property crime and anything below something the FBI keeps statistics on. And I was going to ask a leading question about that, but I'd like to get a discussion about the public safety levy sooner rather than later.
So, Sheriff Trapp, the question I have is, you were talking about, and this has been an ongoing discussion ever since I've been on the board, but the issue of staffing levels. And what are you hearing, say, from, maybe let's talk about a wealthy county like Washington County. Are they having the same challenges as, say, Lane County, or is the reputation out there about Lane County, yeah, that's a timber county, and you're lucky you're going to hold on to your job for 3 years, or whatever the case may be, or are you hearing, or maybe, because I'm trying to get an understanding maybe of the comparisons on where we are, and but from your perspective, what are you hearing from your colleagues from around the state?
As far as their struggles with staffing?
Yeah.
Well, I think, Washington County specifically, like you mentioned, but, the other counties that aren't struggling with resources like Lane does, they're not struggling with staffing levels because they can't fund them. If they're short-staffed, it's because they're struggling with the hiring and recruitment efforts that we all see state and I think nationwide. And that's why you're seeing agencies that are offering signing bonuses of substantial amounts of cash, and to include leave banks being loaded when you sign on, and a number of things to make the applicant say, I'd rather work there than here simply because I can get thousands of dollars when I sign up versus the other place that I don't. And so they're strategizing across the state on how to be the most effective recruiter of the highest quality candidates. But I don't think we're equally comparable. We all struggle for the same recruitment efforts. We're all trying to find that same high quality candidate. So we're all competing in that effort. What I hear about counties like ours that are struggling with being able to fund the budgeted positions in the first place is simply just sympathy. I don't have any other specific to share. It's just the other sheriffs recognize that the Southwest 7 kind of group of counties are in a very awkward position and have struggled for years trying to find replacement funding to get out from under the demand of the timber dollars. And all have struggled. I don't think any of us have found the success yet to put the burden behind us of how to fund our resources. So I think you'll find the other sheriffs are intrigued with the conversation. They're very sympathetic, and I think they're very grateful that they have other funding sources.
The good news is we're not just Phoenix.
Yeah, and it doesn't take me long to recognize there's a couple other counties that are much worse than Lane is. So we're doing okay if you want to compare it to the worst of the worst.
Right. Thank you.
Okay, I think I'd like to conclude then the Sheriff's Office presentation and ask, are you prepared then, or do you need any time for the public safety levy portion? Are all the players?
I'm as prepared as I can get.
Steve, you guys are ready to go?
We are, Mr. Chair, unless the committee needs a break, we can jump right in. We have a memo here that Christine is passing around. This memo is from Sheriff Trapp, myself, Christine Moody, and Debbie Howell in the Sheriff's Office. It walks through the question that's on the table. It provides some background to the committee around the voter-approved levy from 2013. It also discusses why we are where we are related to the levy fund. It also provides information around youth services that we talked about earlier, the revenue collected for youth services that matches the expenses, the reserves that youth services has in place. It provides you a table that I think is really significant. Over the last 3 years and proposed next year, all of the revenue sources for the jail that helps answer some of this question around why we are where we are. So the sheriff is going to walk through that. The sheriff is, I think, the most appropriate person to provide that history and context for you. I want to just set up the conversation with two considerations for the committee. One, and this is sort of, as we go through this, these are the questions that I think we propose that you try to answer. First, what is the appropriate rate to set to fund the operations and keep the promises the county made to voters in 2013, as well as maintaining an appropriate reserve. And what is an appropriate reserve is certainly a subjective question, but we can have more discussion about that. So what's the appropriate rate to fund the operations, keep the promises, and maintain an appropriate reserve? And then two, how do we ensure that youth services maintains funding for the 16 youth beds, is that the funding for the 16 youth beds remains stable? So those are the two questions. And then I will just say before I turn over to the sheriff, the question was raised about, does the county have the authority to do this, to actually levy less? So the voters gave approval for up to 55 cents. We've asked our county council, and it was one of the first questions we asked as well, do we actually have the authority to do that? And the answer is yes. The budget committee has the authority to set property tax rates, and you do have the authority to collect less than what has been authorized in this case. So I wanted to provide that context to you. So the sheriff will walk through the history and background. Then we have a subsequent handout which will provide options, and we'll walk through those options as well as the potential impact to taxpayers, to property taxpayers as a result of that. And we're going to try to do this as quickly as possible so that you're able to have conversation. And I think all of us are prepared to stay here as long as you would like. And then we'll be here on Thursday as well.
Okay. I was trying to get your attention. I think what I'd like to do, being just handed this and being this is a critical document, I'd like to take 3 or 4 minutes and just let everybody read it. So at 4:35. So everybody please take a look at what we've just been handed.
Doesn't say this is 8 beds.
Okay. Chair?
Thank you. So I think most of us remember the skepticism of the community when we were seeking the approval of funding for the jail and the history of the failed attempts at funding public safety in Lane County. And so recognizing that and understanding what that meant to the community, Sheriff Turner at the time and I and several of our staff spent many hours, many nights, many weeks talking to the community in various forums all around the county. I found Grange halls I didn't know existed. Great conversations from 2 people to 100 people in various locations. And all of that to recognize that if we were in fact going to ever be successful in funding public safety through at least a levy effort, that we had to structure the ballot language in a way that put sufficient sideboards on the use of the funds, that the community could be confident that the funds would not be otherwise spent, misused, or supplant existing revenues, so that the community knew that what they were seeking to purchase in services would actually be provided. And we had some history 23 years ago now where those misgivings originated from. So they were valid misgivings. And so we were ultimately successful in the community's support of funding for the jail. And in preparation for that, we knew that if the community was willing to support that levy, that it was absolutely critical that we would not fail at providing the services and keeping the promises made. So part of that was making sure that we had a conservative and safe financial forecast to make sure that there would be sufficient revenues through all the combined sources that feed the jail, to make sure that we would always be able to have no less than 255 jail beds, and that the youth services piece of this would also work, and that the audit was there to make sure that the funds were used exclusively in the manner set forth in the ballot and consistent with the board order that accompanied that. And so in preparing the forecast and the budget and what we decided we needed to ask for to fund the beds at that amount, or that level, we had forecasted specific projections in several categories. Those were, we asked the tax assessor to tell us how many tax dollars we would collect each year for the 5 years. And so, of course, that has to be made on projections of growth of the tax collections. We also anticipated a certain level of general fund support that would continue to feed the jail, that we knew we weren't going to be able to remove the general fund entirely from the jail and place the levy, and that was one of the concerns of the voters. And we also had other funds that were included in that feed the jail through contracts and various other Senate bill measures that provide funding. So very conservatively set out to say at this projected budget for a 5-year window, we're confident we can keep these promises. And we essentially built the budget forecast on a worst-case scenario, that all these other funding sources would be underperforming, and we were sure that we could still provide the service, deliver the services, even with underperforming forecasting. What actually has happened in the last 3 years is we have almost a best-case scenario. All of these categories have performed more than anticipated. In the last 3 years, we have collected $2.5 million more in taxes than the assessor estimated that we would collect on the levy. We also have collected in the other funds category about $2.5 million in other funds that support the jail. So that's $5 million that we hadn't anticipated. And then in the last 3 years, we have actually received $5 million more of general funds into the jail's budget than we had anticipated and forecasted that we would. And if you count the proposed budget that we're looking at for this coming budget year, we're at $6.5 million general fund dollars over what we thought would be feeding the jail. So now you're looking at least 11 next year's projections. We're looking at $13 million of unanticipated revenues in addition to the levy funds. So what that has allowed to occur is the reserve to grow beyond what we had anticipated. So the reserve is at or over 20 million now. And so one of the pieces that we recognized in the community conversation was that they also expected us to be very prudent with the managing the budget. And so the other piece that has added to get sidetracked for a second. The other piece that's added to the growth of the reserve is we've underspent the levy, and part of that is because we have been very careful with using the levy funds, only using them in ways that we are absolutely confident we can clearly defend with no question or no difficulty at least. And the audit bears that out. And so, but with under hiring, the slow hiring process, we haven't spent our personnel expenses as fast as we thought we would. The county administration has done some great efforts at reducing our personnel costs, or personnel cost savings come in there with the healthcare costs and maybe some savings and some jail contract adjustments. So the expenses have been controlled in a way that I think are better than we anticipated. So we were then challenged as a group as we started budget deliberations and looking at what appears to be a collection of revenue and a reserve account building beyond what is needed to run the jail. And we have recognized that we have met and exceeded every promise we made when we asked for the jail levy. If you read the ballot language, it says that we would fund a minimum of 255 beds and at a level of jail capacity sufficient to not release violent felons pretrial. Not only did we immediately double the jail capacity to 1 bed, it just happened to be that was the bed count when we added the beds, but it became 256, so we exceeded the promise of the jail capacity by 1 bed on day 1 of the new fiscal year after the levy passed. We're now at a 13-year high, far exceeding the capacity of the jail promised, and for the 3 years we have not released a violent felon or a Measure 11 offender. We've kept every promise in there. So we're recognizing now at the capacity we have today, we can continue to serve the jail population at this level, continue to meet all of our needs, and not need to continue to collect additional revenues to grow the reserve, and actually, probably more appropriately, it'd be good to shrink that reserve a little bit to a more reasonable amount. And so that was part of the conversation as we developed our budget moving forward with the budget planning group, and that's where we're here today. And so we'll throw it over to County Administrator to follow up.
So now we'll hand out, Mr. Chair, options. There are 6 options for the Budget Committee to consider that you'll find on the first page, and on the second page you'll find the potential impact to property taxpayers, and we'll walk through each of these. I wanted to just note on the third page of the memo that we provided to you, it does provide the financials for youth services. And so it demonstrates the current year property tax, the personnel services, materials and services for total expenses of $1.6 million, reserves of $680,000, and youth services that we indicated.
Mr. Chair, I was wondering, since we know that 91% of the levy goes for the jail and 9% goes to youth services, if we could hear from youth services before we go over this. We heard how the jail, we use the 91%, but we haven't heard how the youth services use the 9%.
Well, that's a good point. Have we heard from County Council? Can youth services be held harmless and the appropriate reduction that the sheriff was suggesting?
So you have in your, did you want to? Yes, and what I would just say is in the memo that we handed out, you have the ballot language and you have the board order. The board order that the board adopted on the second page, I'm looking for the number, the second to last, further ordered, it references the 91% and the 9%. Approximately 91% and 9%. Ms. Moody, want to share a comment from County Council?
So we could have County Council come talk to you at the next meeting too. He wasn't available today, but we have talked to him before we even really got into these discussions, and he's indicated that he would probably recommend a board order indicating that the percentage has changed, just to keep everything very clear, but that's well within the board's ability to do.
So we can separate the two. So as we look forward to Sheriff's Office levy reductions, we're going to hear that we can leave youth services whole. Okay.
And that's what we'll present to you in these options here. That would be an action if depending on what the Budget Committee decides to do related to the rate, the Board of Commissioners may or may not choose to adopt a board order that made an adjustment to language to reflect that. So the options...
Hold on 1 second. Okay, so my question for the Budget Committee would be, do we want to pursue this and have a Budget Committee decision, or do we want to look very carefully, have a Budget Committee decision and look very carefully at how the commissioners vote, so if there's consistency? And I'm posing that to anybody that would like to answer.
Maybe I should weigh in one more item for you, is that the Board of Commissioners cannot change the rate once the Budget Committee levies it. So that is why that discussion is coming here rather than the...
Okay, so once we establish the rate, the commissioners are
that is always the case.
Pretty well bound to that.
Yes.
Okay.
Yeah.
But the commissioners have to pass the board order changing the percentages.
Right.
Okay. But you can't change the percentage. You just pass
Can't say the amount of the levy. Can't change the amount of the levy. Only the Budget Committee can do that.
Okay, because I want to honor the commissioners as a group, and I want to be right by the Budget Committee. And this is, I understand the difference between what we do and a supplemental budget, but I want to make sure that we are honoring both groups in this discussion. Yes, sir.
I just wanted to say that I think it was helpful for Sheriff Trapp to describe the use of the funds that the Sheriff's Department put to it, and I'll just reiterate my request that the youth services be allowed to talk about how they used the portion of theirs before we go on to how we might change it all.
Okay.
Would you like that now? Kathleen, you want to come on up? Put Kathleen on the spot. She's been in the position as division manager for a month. So as I shared earlier, and then maybe if you have any other details, or Lisa, you want to come up as well. We fund 8 detention beds and 8 treatment beds, and a lot of that cost is staffing. We also do a portion of intake control. It allowed us to go from 8 detention beds to 16, and it allowed us to go from 8 beds in treatment to 16 beds. Is there anything else that you would add? That's big
No,
picture.
other than we were able to keep the intake open 24 hours, as I think maybe Commissioner Carr spoke to, was the ability to keep the intake open. Okay, sorry, yeah.
So, did you need more details than that, or is that
Commissioner Sorenson's question?
Yeah, how much did that additional intake, to keep the intake open 24 hours a day, how much did that cost? And how much did it cost to double the detention and treatment beds?
Yes, yeah, I would say the detention in the Phoenix beds and intake was the 1.3 million.
So
the total is 1.3.
And it seems that we can verify this, but we added another position to be able to stay open 24/7 with the intake. So it depends.
It's in the 1.3.
Correct. But that is...
So the total budget of youth services is 1.6, and this is 1.3 of it?
So Christine, maybe, I don't have my budget book up, maybe.
Yeah. Since I was the one that put that in there, maybe I should. This is the levy fund in youth services, is what you're seeing on the last page of the memo.
Okay.
So right there, for 16 and 17, the levy amount will be about 1.4, and then there's some other Title 19, thank you, money that goes in there for a total budget of about almost 1.7.
How much general fund goes into it?
That's
Zero.
right, not on these beds, right. So that would be the beds that already existed.
So Commissioner, are you asking how much general fund goes into the whole or into these beds that we're talking about, these 8
Well, it
additional?
says that the total expenses are 1.6 million. You just told me it's 1.3 million for these 16 beds, plus the intake to be open 24 hours. So I just wanted to know what was the difference, the other $300,000.
We're able to bill on the treatment side, on the treatment beds.
That's what Title 19 is the billing revenue.
That explains.
Larry?
I noticed all these proposals, the options, keeps you services whole.
Is there a reason or an option, or that we don't have an option of increasing the percentage to youth services with some of the surplus, or is that not something to be considered?
I'd like to walk through the options. I think that our approach was to say, and I would welcome others who are here for this discussion in 2013 to weigh in, but that the percentages were developed. What's in the board order is 91% for adult, for the 255 adult beds, 9% for the 16 youth beds. And that equates to approximately 50 cents for the adult beds and 5 cents for the youth beds. And so I think our feeling was that it was the intent of the board when they adopted that to remain as consistent with that as possible. The dynamic related to, because of all the reasons that Sheriff Trapp outlined, the $13.8 million in additional revenue, as well as the delay in hiring, has created a dynamic that allows the Budget Committee and the board to consider lowering that rate. And so I think the answer to the question is that's a discussion you can have, and then I'd encourage certainly commissioners to weigh in on. But from our perspective, we didn't recommend that because we didn't think it was consistent with the action that the board has previously taken. Yes.
Bert?
So just to make sure that I've got it clear, when I'm reading through this option sheet, this basically, at all 6 options, keeps the sheriff's office fulfilling what they promised.
Yes. Yeah, so, real quickly. So essentially starting at the bottom, option number 6, that is, in our assessment, that is the lowest that we would feel confident going forward, the lowest amount of revenue collection for the next 2 years. And this, again, to remind, this is a 2-year proposal. We're asking that we consider this to be for the duration of the levy, the next 2 years. And we feel that option number 6 at the bottom is the lowest rate that would be appropriate and prudent for us to go, where we would still be able to make sure that we meet the current capacity. What we don't want to do is start closing jail beds because we've not collected enough money. And so this will allow us to continue existing services for the next 2 years at this rate, and then continue to have a reserve that is sufficient for operations if the levy was not to renew, to allow us either time to reassess another ask for levy or to at least a period of time to work through whatever the consequences of that would be. But at the same time not have an overly aggressive amount of revenue in a reserve.
Mr. Sheriff, would it be all right if I walk through these options?
Yes. Is your question?
Just to match that up, they both so that all the options keep the sheriff's department fulfilling its promise and youth services fulfilling their promise.
Yes.
Okay. Go ahead.
One clarification, if I may, before it is pertaining to reading through the options. It maintains a 5% throughout, and it's council's opinion that that 5%, 5 cents, which originally was supposed to be 9.9%, it shifts dramatically from 9.9%. Are we still within the spirit of approximately, even though it shifts fairly dramatically from 9.9%?
Well, that was the piece that he said the board may consider doing a board order just to clarify it.
Gotcha.
Yeah.
Okay. Thank you.
Yes.
Okay, Steve, go ahead. One thing that would be helpful to me is know the time. Part of what I'm looking at is how long before you have to get another levy is part of my thought process. So if you can include with each of these options how much time that buys you before the next levy, that would be helpful. Okay? Go ahead.
So the 6 options here that we've laid out for you. Option 1 maintains the levy at what it currently is, 55 cents, with 50 cents going to the sheriff and 5 cents to youth services. You see this fiscal year 16-17 column, that's the estimated next fiscal year, and then 17-18 is the year after that, which are the 2 remaining years on the levy. Okay? So the levy expires June 30th of 2018. So you'll see the estimated revenue from the 50 cents. So in the first option, if the budget committee decides to maintain it at 55 cents, and 50 cents goes to the sheriff and 5 cents goes to youth services, that 50 cents, which is the current collection to the sheriff, would net approximately $14.7 million. Next fiscal year, $15.3 million. Fiscal year after that, you see the expenses at 10.9 and 11.3, and then the reserves. And then the options go in 5-cent increments. Option 2 is levying a total of 50 cents, with 45 going to the sheriff, 5 to youth services. So to answer the question about what's the impact on youth services, all of the options we presented assume that you would maintain 5 cents going to youth services, and the board still needs to contemplate how to deal with that related to the board order and any adjustments that may need to happen. But that's the assumption that we've made in those options. So you see, so as you go down, option 2 is 50 cents. Option 3 is 45 cents, again with 40 going to the sheriff and 5 youth services. It's when you get to option 4, 5, and 6 that you'll see in this line jail reserve increase / in parentheses decrease by. Option 4, 5, and 6 each demonstrate a negative cash flow over those 2 periods of time, which means that you're dipping into the reserves in those 2 years. And that's a net. So the jail reserve increase-decrease in option 4 is $719,424 over the 2 years. So that's how much we would decrease in reserves over those 2 years. Option 5 decreases the reserves by 3.7 over those 2 years, and option 6 by 6.7. And so what the sheriff has shared with you is, from an operational perspective, the sheriff's office believes that we start to get into risky territory if we go below option 6. And our view is that somewhere between option 4 and 6 at least addresses the issue of dipping into those reserves over those 2-year periods. And I think that's as far as we'll go in terms of providing you, unless you have further questions, with any recommendations. And then I would just say on the second page, and then I'll shut up. On the second page, because the natural question is, what is the estimated impact on a property taxpayer? You see, this is 2016 projected median home value in Lane County, $175,000 assessed, $220,000 real market. So based on that estimation, the annual impact on that property taxpayer, depending on the rate you would set of those 6 options that we presented to you. Actually, of the 5 options that do something different than what we currently have.
Okay. Mr. Sorensen.
Looking at the first option, option 1, where we maintain the 55 cents, the reserves at the end of FY 17-18, when the levy runs out, would be 31 million in reserve. We're spending 11, 12 million of that. Would that mean that we could carry that money forward to the next fiscal year and use it for the purposes of the program and fund another year of the 255 jail beds?
Yes.
And would the rationale be to lower it in order to get the voters to say, well, gee, they lived within what they needed, and then sometime in 18, ask the voters for that lower amount, whatever we project to be the proper amount? Is that the idea?
Well, I think,
or is it to get rid of that 31 million in reserve?
Right. I think the discussion about when to ask for a renewal and what the renewal would look like is a different discussion for a different day as far as my concern at this point. My concern at this point is making sure that we stay the course with the commitment we made to the community when they invested in the jail with this levy process. So one of the things I think is critical is that if the county isn't in need of additional resources, we shouldn't be collecting additional resources. I think it makes more sense and is better for the members of the community that if we need those services to meet the promise, then we collect them. If we don't need them, then my position is we shouldn't collect them. And that does a couple things. One is it continues to demonstrate that we're being as prudent as possible with our community's money. And secondly, it also reinforces that we're not going to ask for funding for services unless there really is a need for it. And we demonstrated this, I think, a very significant need to enhance the jail and youth services when we asked for this funding. And we're at a point now where we've met those needs. The community is measurably safer because of the investments made. And we can continue to provide the level of service we have today with this substantially improved from 3 years ago without additional revenue. So that's where I'm at just as an individual and as a taxpayer and a member of this community is that my perspective is if government doesn't need our money, we should probably be collecting it. And that's where we've come to at this point. We're collecting a lot of reserves that can't be spent because of the appropriate sideboards on this specific levy revenue. And so it is this discussion for me is do we continue to just collect it outright, or do we start paring down that reserve that seems to be well beyond what we need to manage this for the duration of the levy?
Okay, quick process question. I have Dale, Herb, Pat, and Larry in the queue. It's 5 o'clock. And Lori, 5 o'clock. What is protocol for extending the meeting?
We don't have a 35-minute discussion on this on Thursday on our schedule. Am I misreading this one?
I'm asking if we want to continue now.
My answer to that question hinges on whether we have another 35 minutes scheduled for this topic or not.
Okay, yes, we do.
Thank you.
That we have.
I imagine we're going to take more than 35 minutes on
Yes,
it.
but how much more time do we want to allow today?
So I would propose 30 more minutes since we have
Move to
everybody
extend 30
here.
minutes.
We're rolling.
Second that. Move to extend 30 minutes.
Okay, so consensus on that. Okay. So Dale.
My question is, if the levy played out to what the projections were, what would the reserve be at the end of the 5 years? Would it played out exactly as projected, or would there be any?
Oh, on the original projection at $5 million?
5 million. So even at option 6, it's over 3 times as much as originally.
Right, and I think at this point in the projection, we would be at 8 or 9 million. And then we would start drawing it down in the original projections. And of course, those are off from what we thought, so.
And I just add, I think that's an important point, that it was always assumed and projected back in 2013 before this went to voters that in the last 2 or 3 years of the levy, we would actually start spending down. So that this reserve would be built up, and then in the last few years that would be spent down. What wasn't anticipated was that all of the things we talked about that have generated the the amount of the reserve because of the additional revenues that have come in and the delay in hiring.
Okay. Herb?
I think my question's been answered.
Okay. Commissioner Farr?
Thank you. Sheriff, I understand and respect what you're saying. We have two different discussions here. One is what do we do with the current levy before we really talk about the second levy. But something to think about is that if we reduced it, let's say we took it to option 4, which takes it to 40 cents, 35 and 5. That roughly keeps the reserves the same. So we maintain close to an equilibrium in the reserves. So we're not spending the reserves down. But what that does give us is an option that when we go back to the levy, when we ask for renew the levy, we can keep it at the same rate we change it to. So we're not changing the rate. So if we change it to 40 cents now, maintaining the equilibrium in the reserves, we could presume that we're going to maintain that equilibrium. That's the best presumption that we have anyway. And when we do ask again, presumably once again that we ask again next year or the year after, we can be asking for the same amount we've reduced the levy to, so we don't have yet a third amount. That would, if we're spending the reserves down, we would have to ask for more than would be adjusting the levy to. We'd be having to ask for more than 40 cents. Or more, if we reduced it to, say, option 5, 35 cents, the request to renew the levy would be more than the 35 cents that the levy had been reduced to. So we'd be asking for more for the next levy. Whereas if we went to option 4, in all likelihood, be asking for the same amount that the levy has been reduced to. So I'm a little bit reluctant to say, well, you're currently paying 35 cents, but to renew it, we're going to have to ask for 40 cents or 45 cents. I think that's a much more difficult question for people to swallow. If you're just saying we're going to be asking for the same amount, and we believe we can maintain it at the same amount, then whatever, the reserves aside, the reserves become a different issue. What do we do with the excess reserves? Probably just keep them in reserve, which is a prudent thing to do. But that's my concern, is having to go back to the levy and asking them for more than they're actually paying currently. That's never a good thing.
Okay. Sure.
Yeah, just striking that. We anticipated an $8.1 million reserve at the end of this fiscal year, and we have 23.2. What's prudent in this case? It was $8 million, right? You said it.
Well, yeah, that's a discussion I'm hoping you can work together and help us decide. I think, in my mind, what I'm comfortable with is not below option 6, and I'm confident we can end this term of the levy, providing the full range of services we provide today, both in the jail and in youth services, with that amount. And that leaves us with a reserve that would carry us over for probably an additional year if we needed that to continue the funding. And so, or if we, for some reason that doesn't occur, that allows some time to slowly reduce service delivery as opposed to turning it off and emptying the jail all in one weekend. So, I mean, it makes sense to keep some reserve, and that's the question that I'm asking for your help in this discussion is what seems appropriate. And I go back to, from the perspective of our residents, what should we be taking from them as a tax compared to what our needs are to provide the service that we've promised to deliver to them. And that's the piece here that I think we can do it for less for the next couple of years.
Do you have which option do you like the best at this point?
Well, I'll just be candid. Like I said before, I think, I know that we need option 6 at the minimum. And then the question beyond that for me is how reasonable in it, and I could be, depending on the discussion and the issues that are presented, I could be convinced that we should collect more than that. But right now, I'm thinking maybe, that's if I had to say what truly is your need to continue this levy to meet the promises going forward, at a minimum, that's what we have to meet. Now, the discussion could be, what if staffing all of a sudden, we have a surge in hiring and we fill those vacancies, all 21 of them, and we're able to add 12 more and open 96 more jail beds? Well, could I do that on option 6? Maybe not. So maybe option 5 or option 4 is more appropriate, and it gives a little more flexibility to managing the jail with a little more opportunity for change, and we're not held at just the bare minimum. So, there's a reason you don't have an option 7, because that's not going to work. And I think we can make this work from here forward for the next 2 years without any adjustments downward in service delivery. I can't say for sure that we could do upward service delivery adjustments at option 6. And so, there could be an argument, the more I talk out loud and convince myself that maybe there's an argument for a little bit higher, because it does afford some opportunity for some flexibility that we wouldn't otherwise have at the lowest rate possible.
Okay, Commissioner Larkin.
So one of the things I was looking at, and I noticed that this doesn't seem to be an option, and I'd just like to ask maybe the question why, and that would be, have you thought about reducing general fund expense into the jail and instead move that into other policing opportunities such as patrol?
Yeah, well, we not only have we thought about it, we actually have done it last year, last budget. We had some internal adjustments within the sheriff's office budget. We actually received more general fund last year from the budget committee and the budget process to offset the elimination of the road fund for patrol. And so that we actually have done that. That has been met with some scrutiny, and the fact that we're still providing more general fund to the jail beyond what we anticipated, and the fact that that does allow us to continue to exceed the promises made in the levy effort, notwithstanding, that does cause people to raise an eyebrow and scrutinize what we're doing. That was not done by the board. That was not done by the budget committee. That was approved in the budget process, but that was an internal decision of the sheriff's office that we were going to make that adjustment to maintain that critical patrol service. Otherwise, we would have probably eliminated it in last year's process.
Well, I think it calls, from my perspective, it's called business sense. I mean, I don't know. If I knew that I had an increased amount of reserves moving in one operation, and you could sustain that, and then I saw that there's an issue in another operation where you could take, where we know that the one fund has to be allocated to the one operation period. But general fund, you should be able to take that and move it into another area. So I mean, I'm just putting my business owner hat on here for a minute. And that's why I'm just suggesting that if that's an opportunity, because, again, we talk about the 57 fatalities that occurred in Lane County last year, and that's the lack of patrol, not only for Lane County, but also the lack of state as well. So I'm just throwing that out there as maybe for something for the budget committee to think about. Now, I'm also saying that I'm not going to bark whatsoever about decreasing my property taxes either. I mean, so that's always a nice option to have. But I'm also thinking about what is best for the sheriff's department and what you think is best for the sheriff's department. But, I'm, like you said, this is a pretty, it's not something that you would come to expect what we're having this discussion about whatsoever in these times here in Lane County. So maybe it's almost confusing, the fact that we have this. Plus, you like you said before, you have more beds open today than you did 13 years ago. And so I think that's the real positive that has come out of this. But just throwing that out there, and I'll just...
We have given that very intentional thought. And there's a couple of things we have been very intentional about. One is we have put the levy funding in the jail exclusively in jail beds. Mm-hmm. We have funded operations in the jail where the costs have gone up with the general fund, and we have used the levy funds so that they are the most trackable, visible, and identifiable and in the most pure sense of jail operation, in the language of the ballot, as jail beds. We haven't used the levy where we could. We could fund the booking program with the levy. We could fund administration with the levy. But then it becomes less visible, less hard to track, and you start funding admin. Somebody could argue that that's really not jail operation, but you can't operate a jail without administrative programs. So that was a very intentional act. The other piece that has been very intentional is that we want to make sure that we can run for a period of time and instill confidence in the community that we actually can, as a county, and certainly as a sheriff's office I'm most concerned with, but as a county as a whole, that we can actually manage the funds of the community in a way that they have prescribed and entrusted us to do. And what we have not wanted to do is create any potential for an argument that clouds the water, that you could have an argument that we have operated outside the parameters of the promises kept. So it doesn't mean we can't do more flexing of our budgeting than we have, but the more we do, the more potential you get for discussion that causes conflict with the perceptions of how we're managing money. So we have been very intentional in what we've done and extremely conservative in what we've done. And last year, the adjustment of general fund within the sheriff's office from one division to the other was done just as you said. Why would we let the patrol division absolutely collapse and disappear when there is general fund that can be moved, and that general fund that was continued in the jail budget still exceeded what we expected we would be putting in there. So we weren't diverting in that true sense. And so we have done that when it's been absolutely critical for critical service maintenance.
I'm from Springfield. We have more common sense, I guess, and I didn't think that was the case. So.
Okay, Dave?
I think we'll.
Lori?
I want to bring this up one more time and then and maybe hear from staff about it before I completely let it go. This idea of reapportioning, not necessarily in its entirety, but some to youth services. Because when I look at the language in the board order, all the whereases are the same and apply as much to youth services as to jail beds. And when I look at the language of the ballot measure, it's for jail and critical youth services. And it's to maintain a minimum of 255 local jail beds and provide additional counseling, secure treatment, and detention for Lane County youth offenders. So I don't see anything explicitly in the language that necessarily precludes reapportioning even some small, reducing the levy and reapportioning some small amount if there's a benefit and we can get better service. And I particularly want to bring that up in light of this new model that we're being asked to really consider about a complete system. And we know that early intervention is the best way to reduce crime and behavioral health issues later, is to work with folks as early as possible when they come into the system. So I'm just really wondering why we're not looking a little more at flexing, perhaps returning some of the money to show fiscal responsibility, but also reapportioning some of the money to youth services. I think it's completely consistent with the language in the board order and in the ballot measure.
Yeah.
I just wondered if there's any response to that. I mean, maybe I'm just asking something that staff isn't seeing a need for, but.
Yeah, why don't we, Alicia, maybe we can talk about operationally, and then I would just say, I think that's a policy decision. So I'm not comfortable giving you an opinion about what you should or shouldn't do about that. I'd encourage those citizen members and commissioners to weigh in on your perspectives about that issue. That Alicia can talk about operationally what the impact could be or where the needs are.
So we looked at keeping the nickel, I will tell you. And I could come back, if you'd like, and work with Steve and Christine and say, well, I'm going to back up and say, we're very clean as well at youth services. It's detention beds, treatment beds, and that piece of intake control. That being said, some costs have increased around overtime, and we could run some numbers and see what we could use. I wouldn't want to take more than we can use, and with a good reserve, but we haven't really run those numbers that I know of. So I would ask that if you're interested, to give us some time to do that.
Yeah, and then I would just, if that is an interest, please give us that direction, and we can do that analysis and bring you back some options. And then I would just say, I think that I agree with the sheriff from the perspective that we've tried to do everything to maintain both the letter and the spirit of what was adopted, because trust is really important. And I'll leave it there.
Yeah, I just had, so I understand the ballot measure language and everything, but there was also I think the promises made by Sheriff Turner and DA Gardner when they were out selling it to the community, and it might not be legally binding, but it's kind of what the trust was built on, is it was their word on what it was going to be used for and everything. And it seems like even with option 6, you're 3.5 times over what the reserve was going to be had things went how they were supposed to go. So I would worry a lot, and I think it would break a lot of the trust built with the community if we thought we knew better than what they approved and started readjusting funds.
Okay. Thanks. Sort of to add on to that about the expanding youth services, when we chose to use a serial levy for expanding both these projects, one of the things that was understood was, being a 5-year levy, it was possible to hire people knowing they had a job for 5 years. At this point, if we were to change the levy for the youth services to expand for the last 2 years, that may not be enough to entice people actually to take a job to expand that program, knowing that by the time you go through the hiring process in the fiscal year, you may be 6 months in, so you got 18 months left of your job that's assured, whether or not the voters have passed the approvals. That was just a little bit of a caution in trying to change that portion. I will note a couple things. The piece about 91% and 9%, the language there is suggesting jail operations receive approximately, and youth service shall receive approximately. It's much more flexible. The piece about moving discretionary general funds is the Board of County Commissioners shall, not discretionary language, shall continue to appropriate discretionary general funds to fund the jail services to meet the 255 plus the 8 youth detention beds and 8 treatment beds. So it wasn't as flexible. I would feel very uncomfortable reducing the general fund into the jail to move it to any other program.
Even within the sheriff's office.
Even within the sheriff's office. Because that was not what was put out there as we asked people to pass this. And it was the past history of the board over 20 years before we passed this measure, where they actually did something where they took, where they reduced the sheriff's, they passed a levy for the sheriff and then reduced his general fund contribution. That led to that need to have that kind of language, because people still remembered 20 years later. And when I was out helping campaign for this, and Sheriff Turner and I were doing town halls the fall before this ever even came before the board to try and build the knowledge base for people to accept this. That action the board 20 years prior kept coming up, and it's one of the reasons why it was built in so strongly to the board order. So, but that all said, ending up with a reserve that is almost three times the level of what it takes to operate annually. Having 3 years of reserves at the end of the levy was not exactly what we were promising folks. I don't think that was anyone's imagination. So I do think that some adjustment in here is necessary. One of the questions I have, though, and this is when I get down to it, is that in FY 17-18, the estimated expense of 11 million plus. The question I have is, does that build in anything for the fact that we're currently in negotiations with the labor union that staffs the jail and other unions that revolve around that? Is there anything built in for estimated increase in their contract at this time.
There's 5% in personnel and 1% in M&S increase between 16-17 and 17-18.
So I would say maybe not specifically for the bargaining, but that definitely piece of it. It's
yeah.
also merits.
Yeah, that
change in staff
covers
that you
steps
have.
and a few other things. So, and when people get, the longer they're here, the more certifications they get,
Exactly.
longevity pay, whatever else.
Healthcare, PERS,
Yeah.
is going
So
next year.
yeah, PERS, whatever. So I think that answers my question that any change in the contract's not necessarily built in. So I don't mind ending the levy with a year plus in reserves, which I think basically what your option 6 leaves you, because that 11.3 million may actually end up being 12.5. Yeah, once we because it'll be in the second year of the contract, I think, or whatever that we're currently just began negotiations on. So that that's one of the things we need to consider as we're thinking about this reduction is what we're allowing for in that reserve might be we don't get a renewal on the levy. Something happens, economically, folks just, who knows what Cover Oregon or Columbia River Crossing is in the news at the time, and we don't get a reapproval. It'll allow us to at least keep those local jail beds for another year, possibly with that reserve, and have a chance maybe to take another shot the following year. If we fail 2 years in a row, I think we heard the will of the voters, and it's time to close the beds. But I don't think carrying more than a year's worth, much more than a year's worth of reserve is prudent or even meets the promises, without going way beyond what we approved in both the board language and the order and the ballot language.
So back to youth services for a minute. It sounds like they're good with the 5 cents for next fiscal year, but possibly it would be possible to maybe take option 4 or 5, and at the end of next fiscal year reevaluate what youth services needs and possibly give them more than that.
I would just add a comment, Mr. Hare. I think we certainly can present those options to you. One of the things we talked, if you remember last year's budget message was about local control, and we really were talking about, and in this year, one of our 2 top goals was to create long-term financial stability, and so we're talking about ongoing stable resources to fund ongoing stable services. So I think if there was a consideration to do that, I would encourage you to think about it not as a move for 1 year, but as a long-term move, right? Because to provide additional funding to youth services for a year that's not, I don't see how that has an impact. It could have an impact if you said, over the life of this levy or a future levy, we want to appropriate additional resources for several years to add beds or add treatment services in different places. Then that would make sense. But I would think about it as an investment in ongoing services as opposed to, we have some additional resources here we can reappropriate for a year.
I would assume we would do it subsequent to that if we would. Yes.
Okay.
Commissioner Farr?
Thank you. And we have 2 minutes, so I'll keep mine to less than half of that. I think the question of what's best for the Sheriff's Department, the people the Sheriff's Department serves, has come up a couple of times. And really what's best for the Sheriff's Department is to maintain the trust, Byron, that you've developed and that you're building and you continue to build. And to do that, I think what you stated does that very clearly. Option 6 returns as much money as possible to the people who are paying the levy. Develops a trust that if we have excess, we'll give it back, and we'll give as much as we can prudently give back, and we won't keep excess in reserve. And next time, if we do need to, then next time they will trust you when you tell them what it is that we need to maintain to go for the next 5 years of the levy. Should we go that direction? So I think while earlier I talked about option 4 being maintaining an equilibrium in the reserve, I think spending down the reserve a little bit is probably a prudent thing in order to maintain the trust, Sheriff, that you and your department have built in the people that you're serving. So I heard what you had to say. I heard what others had to say around the table, including Dale. And really, when we come back on Thursday and talk about this, I think I'll probably be looking at close to option 6, looking at something like option 6. Not an option 7, most certainly, but option 6 seems to be, for me, Sheriff, I love it when I see you walk out in the public like you did last night, and everybody trusts every word that you say. That's what we need.
I'll make it super quick.
Hang on, I have a question. Which individual discovered this? Who was the first one who brought this to the world?
Well, there's some discussion about that. We're not sure. It was a conversation that originated between the county administrator and I at some point, and it was at this point, I'm not sure if it matters much whose actual idea it was, but the fact that we're here and we've recognized that we have this adjustment to put forward is really what I'm interested in.
Staff solution within the department. Okay, Herb, and then we'll close with Bill.
Really quick, because the county administrator asked if there was any direction to be provided. I guess from my personal standpoint, I'm interested in keeping as close to the spirit of what was put through with this measure. And also with looking at it forward, it's a serial measure. If there is something that should be considered in the reserve, because when you started this from ground zero, you had to build a reserve in order to make it work. And so I'm interested in making sure that there's enough in the reserve that if you came behind this serially, that component would already exist. So from my standpoint, I'd like to see more for youth services, but I would not be comfortable doing it inside of this framework. And I'd like to see us try to do what we can to make sure that we stick to the letter of this and make sure that we meet, if we can, leave the options in the reserve to make it serially flow as evenly and consistently as possible for the voters. So we do what we say we do.
Okay. Yeah.
Almost to make it quick, I would just urge the fellow committee members to go back and look at the coverage of the jail prior to the levy and how bad of a situation it was. And it's looking better now, but not to forget that. And, make sure that we do honor the spirit of what we put out there and build that trust so we can actually get a renewal.
Okay. And what I've done is knowing this was coming, I went to the 5 people literally on the sidewalk. I just stepped up and said, are you familiar with blah, blah, blah? What do you think we should do? And I won't share it, but I have all 5 said exactly the same thing. So that's kind of the position.
Mr. Chair,
yes, sir.
Oh, okay. And before you break, I want to, do you have everything that you need as of now? Is there anything that you are requesting, the additional analysis or information you'd like? Okay.
Everybody hear that? Okay, we have some handouts.
So we have the agenda for Thursday and then a updated sauce form. It's sauce form 31. So you can just replace the one that you currently have in your binder with this
Alrighty. Yes. My back's must be sitting too much. That's, yeah, well, that too.